So good morning and welcome to this formal meeting of the Public Protection and Community Scrutiny Committee. I'm Councillor Nigel Pepper, Chairman of this committee. Councillor Adam Stokes, Vice Chairman of this committee, is also in attendance. Can I remind you that the audio-visual feed of this formal public meeting is being broadcasted live via the County Council's website. And with this in mind, I'd like to welcome members of the public watching this live. Just a little bit of housekeeping before we go any further. I'd like to begin with a health and safety announcement that there's no fire drill planned this morning. In the event of the fire alarm sounding, we'll need to leave the council chamber through the rear doors and leave the building through the reception into the front car park and wait there. Can also remind everyone to ensure their mobiles, laptops and iPads are on silent for the duration of this meeting, please. Requests to speak will be collated by my Vice Chairman. We'll now move on to the formal agenda. Agenda item 1 is apologies for absence, replacement councillors. Trina, over to you.
Thank you, Chairman. We've received apologies for absence from Councillor Danny, from Councillor Key, but we have a replacement member for Councillor Key today, which is Councillor Ray Wotton. We've also had apologies from Councillor Sneath, but to let you know, she's going to observe the meeting today via Teams, Chairman.
Okay, yeah.
And we've also been advised that Councillor Jackie Brockway will be late as she's stuck in traffic. Thank you, Chairman.
Okay, thank you. Item 2 is declarations of councillors' interests. Do any members wish to declare any interests? If so, please speak now. No? Okay, thank you. So the minutes of the previous meeting of the Public Protection and Community Scrutiny Committee held on the 8th of March. These are on pages 5 to 13 of the agenda. This item is to approve and sign the minutes of the last meeting as a correct record for accuracy only. I'll just go through them quickly page by page. So page 5, 6, 7. Well, I picked up something on page 7. It's the second bullet point from the bottom. It just says no specified figures. I guess that must mean no specific figures, if we could just make that amendment there. Page 8, 9, excuse me, 10, 11, 12, and finally page 13. Okay, do I have a proposer for those, please? Councillor Clark, Councillor Mr. Clark. Could I have a seconder, please? Councillor Gray, thank you. Yeah, we'll now vote. You're voting on whether you agree that the minutes are a correct record. So all those in favour, please raise your hand. Okay, those against? And any abstentions? Adams abstained and Ray, yeah? Okay, thank you. Got those noted? Okay, thank you. So those minutes are agreed as a correct and accurate record with that one slight amendment. Item 4, announcements by the Chairman, Executive Councillors and Lead Officers. Just one from me. I'd like to remind you that as from the 1st of April, leadership for public protection was transferred to Glenn Garrett, Executive Director for Adult Care and Community Wellbeing. Glenn is with us in the chambers today. Furthermore, our new Assistant Director for Public Protection, Martin Parker, is he with us this morning? Not noticed, no. I wasn't sure whether he was or not. So that gives me the opportunity to welcome Glenn and also to inform you that Martin is our new Assistant Director for Public Protection. Moving on, Executive Council announcements. Have we got any with us this morning? Is Councillor Corey, is she online?
Is she online? No, she's not online.
No, okay. Okay, sure. Anything you'd like to say, Councillor Morning, in her absence? Okay, thank you. Councillor Mrs. Sue Woolley, is she online today?
I think Councillor Matthews is the Executive Support Councillor.
Councillor Matthews is online, yeah?
Yeah, we've had
No update from Sue. Thank you, Nigel.
Okay, thank you, Councillor Matthews. And Councillor McNally? Nothing to report, thank you. Senior officers, are there any officer announcements from lead officers? Any of those online wish to speak? Glenn wishing to
Thank you,
speak.
Chair. Just to say that I believe that Martin will be dialing in.
Okay, thank you. Sorry, he's dialing in. He's there now. Oh, sorry, okay, yeah. Over to you then, Martin.
Yeah, apologies. I am dialed in. Sorry, I can't be with you today, but nothing specific from me, but just really looking forward to being the new Assistant Director of Public Protection on LCC's behalf and working with members and officers as we move forward, having taken over from Di, who has done a really good job over the last 2 years, looking to take her work forward with our executive members within the area of public protection.
Okay, Martin, thank you for that, and look forward to meeting you in person at some point. Turning to the meeting proper, item 5 is volunteering in Lincolnshire. This item is on pages 15 to 20 of the agenda pack and provides an update from Voluntary Centre Services and Lincolnshire Community and Voluntary Service about the role, impact and future developments in volunteering across Lincolnshire. The report will be presented by, I understand, Ben Rollett, who's the Chief Executive at Voluntary Centre Services, and also Lee Surdyfield, am I right in saying that? Assistant Director Corporate. So, without further ado, over to you, Ben.
So I'll just do a quick introduction,
Okay.
Councillor Pepper, if that's okay. So the volunteering update builds on some of the conversations we've had previously at the committee, particularly in terms of the quarterly reporting that we've had in terms of volunteer numbers and the engagement with voluntary organisations. The focus on volunteering is part of the community strategy that the committee has previously considered and sees a focus on ensuring that we have strong communities and that volunteering is well supported across Lincolnshire. So the paper that Ben will take you through today presents research from the VCS into volunteering and places a focus on the response coming out of the pandemic. So it builds on some of the conversations we've had previously about whether people are returning to volunteering opportunities, and it gives some insight into both the expectations of volunteers and the activities that are now starting to take place. So I'll let Ben take you through the data contained.
Okay, thank you.
Hi, thank you very much for having me this morning. As Lee said, yeah, I'm going to talk for a little bit about how volunteers have been involved in the COVID pandemic, which I'm sure you're all well aware of. I'm not going to take you word by word through the paper, but I will certainly highlight different aspects of it. Some of you already know me. I've been working for VCS for over 20 years now, and I think for us operating our volunteer centres probably over the last 10 years or so, it's very much been about supporting volunteers to get involved in volunteering locally, supporting community groups and voluntary organisations that support volunteers. But I think as we've all seen, that the pandemic's changed the way we operate, both as organisations and individuals over the last couple of years, and I think it's clear the role that volunteers have played in responding to the pandemic has been really, really well received. But I think looking back probably 2 years when the pandemic first hit, volunteering was at the forefront of the initial emergency response to COVID. Volunteers got involved in very different ways. A lot of people just helped out their family, their friends, neighbours in terms of helping out with shopping, resources, whatever they may need. But also there was more coordinated volunteering, whether that was coordinated through district councils, through parish councils, through local groups coming together, or some of the more established routes through your British Red Cross, through helping out at local food banks, or the national NHS Volunteer Responders campaign, which had a huge reach across the country. I think for us, what we were really keen to do was just help volunteers understand the different opportunities for them to volunteer in the community and how they could help out, and to make sure they could do that as safely as possible as well over the pandemic. So we've estimated our reach in terms of supporting volunteers in the pandemic is around about 3,000, that very much in different ways, as we've talked through, and includes the COVID volunteers engaged in the vaccination programme. So looking back, probably this time, a little bit further than this time last year, January 2021, we've been heavily involved in the response through the local Lincolnshire Resilience Forum and locally with district and county partners around volunteering, and we were asked to get involved in supporting the primary care networks in recruiting volunteers for the locally based COVID vaccination programme. So not your main sites at Lincoln and Boston, but those very local vaccination sites, whether that was from the GP practice themselves, or as you saw in Lincoln, we have the Ruston site down in the south of the city. So we worked quite closely in the early days with those primary care networks to help them recruit volunteers relatively quickly, and certainly some of those sites at scale, but also help them understand how they could support volunteers as well, because majority of the GP practices themselves, whilst they have volunteers involved in things like your patient participation groups, they hadn't had much involvement day in, day out with volunteers coming in and supporting within those practices themselves. So we did quite a lot of work with some of those PCNs to understand how they can support their volunteers effectively. Internally as well, I think in the next couple of weeks, the Apex Primary Care Network for Lincoln is just having a celebration lunch for all of their volunteers that have supported them over the last year with the vaccination programme, which is really nice for them to give something back. So I think we've, again, working through that, we supported, as you'll see in the report, over 550 volunteers in those primary care networks. That was probably the tip of the iceberg. There was lots of other volunteers that got involved directly with those primary care networks as well and supported. So certainly I think throughout Lincolnshire, you're probably looking at over 1,000 volunteers, if not more, that have supported out with the vaccination programme, which was fantastic. But moving on to the Lincolnshire legacy, what we wanted to try and do for Lincolnshire is have a bit of a longer term plan. I think we've seen certainly prior to the pandemic where we've had flooding issues in the county where I think it's fair to say we've probably struggled to mobilise volunteers at scale, with lots of people wanting to get involved and wanting to help out, but actually there's lots in terms of making sure that the volunteers are safe, they're supported, they're trained when they're getting involved as well. So what we want to do is have a bit of a legacy for Lincolnshire where whether it's a pandemic, whether it's a flooding issue, whatever it may be, we've got a cohort of volunteers that are supported, they're trained, they can get involved and help out locally. And it's not just about helping out in emergency situations, but actually they can get involved in one-off bits of volunteering as they go as well. But I think for me, what I'm really keen for us to see is make sure that we can support volunteers so that we're meeting their needs as well. I think the last couple of years, quite rightly, has been about supporting the communities in terms of the response to COVID, but I'm really conscious to make sure that if people are coming because they want to learn new skills, are we helping them to do that? If they're coming to volunteer because they want to get back into work, are we helping them make the most of the skills they're developing within their CV? Are we helping them to volunteer in the right environments where they can really get something from it? So I think it's about understanding the needs of volunteers, and that's one of the things that we were really key to do through this volunteering survey as well. As we've moved, we're certainly working with lots of partners locally on that Lincolnshire Volunteers programme, so to make sure that we can have a coordinated response for Lincolnshire. I think we saw the national NHS volunteer responders have a good reach across the country, but we certainly have lots of people that signed up to volunteer but actually didn't get to go and volunteer. There might have been not been the opportunities in their area. So we're really keen to have something a bit more targeted for Lincolnshire as well, so we can engage people in those communities where we really know the need is. So that's a really exciting piece of sort of work that we're going to be engaged in over the next year or so. But for us as well, moving back to traditional volunteering, you'll see from the report that midpoint in 2020, we probably only had about 50 active opportunities for people to get involved in what we call community and voluntary grassroots organisations. Since then, as we're certainly over 300 roles for people to volunteering locally, which is really, really good. We're starting to see lots of community groups and organisations getting back on their feet, opening up and delivering a lot more face-to-face, and renewing what they were doing before. I think it's fair to say during the pandemic there's lots of groups and organisations that have been able to continue throughout, and they've really adapted their services and what they do, but certainly there's been quite a few groups and organisations that haven't been able to do that. Some unfortunately we've lost, and a lot of them have they've sort of really scaled back over the pandemic. So it's really, I think for us, and it's great to see that so many organisations are wanting to recruit new volunteers. And we certainly know that's only part of the picture. We're supporting lots of groups and organisations to bring in new funding, develop their services, and I think as we're going forward now, managing in the post-COVID world in terms of face-to-face delivery, managing Teams meetings. And certainly we have a challenge when we all go back to the office. Actually, when we've all got Teams meetings, it's difficult to get the space to do that as well. So I think it's a hybrid approach that we're really supporting groups and organisations with. I'll move on now to the volunteering survey, which was a survey that we conducted February to March this year, which, as I said, we wanted to try and understand the needs of volunteers, why people are volunteering, but also how the pandemic might have impacted on volunteering and how we can really support volunteers effectively in Lincolnshire over the coming years. So far, at the time of the pulling off the data, we had 162 people complete the survey. We've still got the survey open, and we're trying to build a bigger cohort of certainly volunteers and data that we're getting from it. But in terms of the first question around the length of time volunteering, almost half of the respondents have been volunteering for over 3 years, which is not necessarily a surprise for us. I think certainly we do see in Lincolnshire lots of volunteers that sort of being engaged in volunteering, supporting different groups and organisations for a long time. But we saw 13% of people volunteering for less than a year, which again you'd like to think that the COVID scenario that we've been in has really encouraged them to volunteer. 17% that are not currently involved in volunteering but have in the past, which for me it was good to see them engaging in the survey around volunteering even though they're not currently volunteering, and also 10% that people that are considering becoming a volunteer in the future, which is great. So I think what we wanted to try and understand is the views of people that are currently volunteering, and also try and attract new volunteers as we go forward as well. So I think from that point of view it was quite a broad response rate. We looked at barriers to and obstacles to volunteering. As you can imagine, the pandemic did present quite a lot. 36% of people indicated they had faced obstacles or barriers that made it difficult for them over the last couple of years. Some of the main barriers, not necessarily surprising, around the COVID restrictions we've had over the last couple of years, and also people having to isolate either due to their own health conditions or family and close friends as well. Other obstacles, again, not surprising for us in Lincolnshire, is around travel and rural isolation, work commitments, and difficulties accessing volunteering due to having a disability. And finally, they're around people indicating that the usual volunteering opportunities weren't available to them throughout the pandemic. Moving on to how the pandemic encouraged or discouraged people to volunteering. 63% people indicated that the views had not changed on volunteering, which is really positive. 22% were encouraged, which I think we did see through the pandemic. Lots of new people getting involved in volunteering, and then 15% were discouraged. And again, I think we've seen some of the barriers and obstacles that may have discouraged them from volunteering there. A real plus for us, that 58% of people indicated they would be interested in getting involved in a Lincolnshire response to emergency volunteering over one-off volunteering. So we have got a cohort of volunteers that are really keen to be part of this legacy for Lincolnshire, which is really something to build on. We wanted to understand a little bit around volunteering habits. 54% of people indicate that they were engaged in regular volunteering, with 7% of people just engaged in ad hoc one-off volunteering, and then a further 10% that they felt they were engaged in both regular and ad hoc volunteering. I think that's something that we really want to promote as we go forward as well, that actually you don't just have to volunteer for one organisation or one type of volunteering. And I think we'll probably all relate to, we know lots of people that volunteer, and it's very rare that you volunteer just for one organisation. People like to get involved in helping out in more than one cause. 29% of the people were not currently volunteering. So I think for me that was really good that we get a spread from people, not just those involved, but people that aren't involved in volunteering as well. The question around volunteering hours, I think for me this is the response that surprised me the most. I think probably people were quite cautious when they were filling this in around the amount of hours they volunteer for, because I would have expected that people would volunteer for probably quite a lot more hours than they've responded here. So I think people are probably being maybe understated and cautious on this one. But again, I think you still see that there is a reasonable spread between the length of time that volunteers give on any monthly basis, really. The next question focused on volunteering prior to the pandemic. And again, quite surprising, 81% of people were still volunteering for the same organisation prior to the pandemic. For me, on hindsight, looking back, it'd been nice if we'd followed up with a question there to understand of those 81%, had they volunteered throughout the pandemic or had those opportunities been limited, and then they're coming back into them now. So that's something that I think we can look to follow up on as well, which is interesting for me. Interest in new roles, 38% people that responded said they would be interested in getting involved in volunteering itself or taking up new opportunities as well. So I think we have got a cohort of people that really want to try something different, which is, I think, a good point for us to be at. And then we wanted to understand some of the support requirements and how we could help people to volunteer. And I think traditionally for us, for our volunteer centres, it has been relatively easier for people that know where they want to volunteer. That they're quite digitally savvy, they can log on and find out where to volunteer, but we do recognise there's lots of people with additional support needs, and we want to make sure that we can support those people to get into volunteering, and make sure we can support them through their volunteering journey. So in terms of those support requirements, 23% of people wanted support just to find out about opportunities, 19 people wanted access to training, and 19% of people wanted more general advice. All of those people as well have been followed up, and we've had discussions around how we can support them moving forward. Focusing on volunteer motivations, again, I think this is something that we've never really dug into too much detail. When people in the past have come to us to volunteer, we sit down with them, look at their skills, their interests, and match them up with appropriate volunteering opportunities. What we've not really done is really dug into what their motivations are. So as you can see there, significant chunks of people just volunteering to make a difference or because they're passionate about a particular cause or organisation. I think that's not a surprise, but I think it's really good that that's come out high. And I think looking at this, it was a generic survey. We didn't target it at certain sectors. So I think looking at the last one where we've only got 8 people indicating that they volunteer to get back into paid work, I think had we shared the survey directly through some of the colleagues at DWP and others, obviously we would have seen a different picture there. So, but I think it is clear that people do want to volunteer because they just want to make a difference and give something back. And also, obviously, you can see there people wanting to build confidence and develop and gain new skills. So I think we just want to make sure as we go forward that we can help volunteers to do that as well. Making volunteering easier, we had an open question there just to understand what we could do to try and make volunteering easier. Some of these things we can certainly look to do in terms of some more local volunteer drop-in clinics and sessions, volunteering taster days, greater promotion and awareness in the Central Bank of Volunteering Opportunities, absolutely. Training and mentoring support, that's something that we want to do individually in terms of helping volunteers, but also look to support some of our larger organisations that host volunteers, to maybe have in-house volunteer mentors and volunteer champions so that we can really get support to volunteers in the volunteering roles. Support to improve confidence, self-esteem. Some of the things that we might struggle with and we need to certainly work with our partners around better public transport, less red tape and need for insurance and DBS checks, and I think there's always a very fine balance there. We need to make sure that we're keeping our volunteers safe, but we need to try and make it as easy as we can in certain roles. So I think there's, again, a balance to be found there. Less paperwork, simpler application processes, and I think that's certainly something that we want to work with some of our organisations on more, just to, whilst we need to understand the needs of the organisation, we need to make it as simple as for volunteers as possible. More time and hours in the day, and I think we would all... again, that's something that we can't necessarily help, but again, I think we can relate to volunteers when they're in that position. And finally, we've just sort of looked at our priority areas for the coming year from volunteer centres, and I think you'll see there recruiting volunteers for traditional roles. I think that's a real focus for us, whilst not losing the impact of the COVID pandemic and really building on that Lincolnshire legacy for us. Supporting organisations develop new and innovative volunteer opportunities, definitely. I think certainly the needs of organisations have changed over the last couple of years, and volunteering roles will have changed as well, so we're looking at how we can support them to develop new roles. Supporting with volunteers with additional support needs, definitely. We know there's lots we can do in terms of a volunteer centre and the organisations that we're supporting to host volunteers to make it easier for people. Developing best practice in supporting volunteers. Again, that's an area that both for us in Lincolnshire and nationally, there's a real spotlight on making sure that we can provide best practice advice for organisations in supporting their volunteers. Providing a range of training opportunities, and we do quite a lot in terms of training for volunteers. When they start with us, we have an online training package. What we're trying to, we're certainly working with lots of our partners now to widen out the training that we provide. We know through the County Council and partners there's a really good safeguarding training package that they offer to partners, so we're widening that out for volunteers. Certainly with colleagues in health, looking at mental health, LPFT do some fantastic training through the Recovery College, so we're looking at how we can widen that out to volunteers as well, so that we can get some really interesting training out to the volunteers there. Supporting the delivery of the Lincolnshire Volunteers Programme, again around that longer term Lincolnshire legacy. Supporting employers to enable their staff to volunteer through employer supported volunteering. I think we've done bits of that over the years, certainly with some district councils and the county council as well. I know when thinking back to it a few years, when the Premier Inn came to Lincoln, when they first recruited, I think 50 staff, we supported them and they all volunteered down at Hartsome Cricket Club for a couple of days and did a lot of renovation work there. And I think it would be nice to support more employers supported volunteers as we emerge from the pandemic. So they, in terms of just raising awareness of one-off bits of volunteering that volunteers can get involved and make it easier for volunteers to help out locally. And I think just raising awareness of volunteering in Lincolnshire and the impact it can have. And I think as we've all seen that through the pandemic, we certainly don't want to lose the ethos of volunteering and the goodwill that people have given. So yeah, it's a very quick snapshot to where we're at. Welcome to any questions.
Okay, thank you. I'd now like to invite members of the committee to comment on this item. I'm aware that Councillor Wharton wishes to speak. So over to you, Councillor Wharton.
Thank you very much, Mr. Chairman. What 2 years it's been. Myself and my wife, Councillor Linda Wharton, immediately volunteered back in March 2020 through Lincolnshire County Council and South Kesteven forums. It was an absolute pleasure to deliver food and prescriptions to people who are vulnerable from the south of the county right through to Nottinghamshire. What I'd like to do today is to thank Lincolnshire County Council and South Kesteven for running those forums, because without their help, I'm sure the members of the public would have been hard to get help throughout that time of period. Unfortunately, some of our people that we delivered to did pass away, but they were all appreciative of our service that we gave them. And so much so that we delivered right up until August last year through the pandemic. What disappointed us really was that we also volunteered for the NHS through their system, and nobody came back to us at all. We could have given them some service there. We had the time. And also I'd like to thank the supermarkets, Asda, Morrison's and Sainsbury's in Grantham area, who we cooperated and worked with, and they recognised us straight away because they knew who we were. We had identification and helped us all they could. The survey, I haven't seen the survey as a volunteer. Nobody's ever asked us how we got on at all, so that's something I can feed back to you. I'm trying to think if there's anything else. And the pharmacists as well, Chairman. As the pharmacists and local pharmacists in Grantham, they saw us, we identified ourselves to them, and everything was ready for us to collect. So I think that's it, Chairman. Thank you very much indeed.
Okay, thank you. Would you like to come back on any of these matters, Ben or Lee or even Glenn?
Yeah, please. And I think that was really good overview, and I think that's really good to hear. I think the challenge with the NHS volunteer responders and the national NHS programme, again, we saw similar challenges across the county where people had signed up to volunteer and not been tasked to actually go out and volunteer. And I think probably just a few months back we got some really interesting data on the number of volunteer tasks that have been undertaken across Lincolnshire, the number of volunteers where they'd signed up, and there was certainly disparity between where volunteers were registered, where tasks were needed. But I think because we weren't able to influence that locally for Lincolnshire, we were certainly in the dark there. And I know we've had some discussions around whether it's possible to get in contact with all of the volunteers that signed up for the NHS Volunteer Responders Programme, so that we can contact them to be involved in Lincolnshire programmes, and we haven't been able to do that through GDPR and other challenges. So I think that's really one of the reasons behind us having this Lincolnshire legacy, to make sure that we've got more control in terms of tasking and supporting volunteers through it as well. So I don't think that was just necessarily a Lincolnshire issue. I think it was a national issue with the NHS Volunteer Responders Programme. Whilst it was really, really good at mobilising volunteers, it did miss some of the local influence that would have made it even more successful.
Okay, thank you. Councillor Wotton wishes to come back on that.
Yes, thank you, Chairman. There's one point
Councillor
which
Wotton,
I forgot to
Councillor Lee.
mention, is that from the beginning, we did have some difficulty with people giving us payment for food, for the deliveries of food, and therefore we had to rely on trust between us and the people. But in the end, we managed to get it sorted out and made sure that people had the cash when we delivered the food. Thank you.
Okay, thank you. Councillor Lee.
Thanks, Chair. I wanted to comment on the community volunteers, Ben. I volunteered to work for the food bank near us. I think it's Community Larder on the Ermine. And I mean, I knew where to go because I sort of have those connections. But I do wonder how easy it is for people who don't always know where to go to volunteer. Could you tell us a bit about how that kind of information is disseminated out to communities so that they know who to go to? And the second thing, I want to comment on the NHS volunteers, because I work on Johnson Ward in cardiology up at Lincoln, and those volunteers over the last 2 years have been absolutely priceless. The staffing within the NHS is unbelievably bad. I've just done 4 13-hour shifts in 8 days and I'm exhausted. That's why I was late this morning. I didn't wake up, did yesterday. But the volunteers have made a huge difference. They do all sorts of things. I've seen them because they've come on our ward and they've trained on our ward. They are well trained. They do all kinds of things. I mean, the most obvious one that comes to mind is because there's no visiting, people want to bring things in for families. And they are allowed to do it now. One time they weren't allowed to. We couldn't even have stuff coming in. But the volunteers would bring things to patients and take things out, washing and stuff. They made a massive difference. And they were the ones that could sit and talk to the patients when actually we didn't have time because we had half as many patients again as we were meant to have because there's no staff. You know, they made a massive difference. And I want to mention one on our ward as well. We've got a man called Mike. He's been doing it. He's been doing it all the time that I've been back, which is over 2 years. And he's just so good. He's just so amazing, and I'm sure he could just go to pharmacy for me in his sleep. Do you know what I mean? They're really good. They make a huge difference, and I want to sing the praise of NHS volunteers and actually the staff at the top of the NHS as well, because perhaps if people didn't get to volunteer who wanted to, I don't know why that was, but I can promise you that we're all doing our very best and we really, really are under siege. You know what I mean? So if things have slipped, it's for very good reasons. Thank you.
Yeah, I would agree. I suppose the NHS, I was talking about is NHS Volunteer Responders, which was a national programme, which was very different to the local NHS volunteers. And we work really closely with Andy, volunteer coordinator at the hospital, and all the volunteer coordinators for the NHS trusts. And we've got great relationships there. And as you say, the volunteers have been fantastic throughout the pandemic and even before that. And you look at the number of volunteers volunteering at hospitals day in, day out, and it's a thankless task for them. They've been absolutely fantastic. So, yeah, I completely agree with that one, Karen, and we'll continue. And they're really keen to be part of this, as the Lincolnshire legacy as well, in terms of helping people get involved in one-off bits of volunteering at hospital, but also those more longer-term roles as well. So, yeah, I certainly agree with that. I think in terms of the promotion of opportunities, I think certainly in the last year, it's been more difficult to get out into those local communities. I think a lot of, as we've seen over the last year, those people that are really digitally enabled, actually it's been easier for them to understand where they can go to volunteer, but actually people that not so digitally enabled or don't want to be on social media all the time, it has been more difficult. We've certainly historically had some real great links into those neighbourhoods through the neighbourhood boards, and we've continued to support neighbourhood boards over the last couple of years, but what I think it's fair to say that some of those boards have really flourished and continue to operate, and some of them haven't been able to. So certainly up in the north, the North board hasn't been able to operate face-to-face over the last couple of years. So some of those grassroots community networks to get the message out about volunteering has been more difficult. So what we've really started to do is look at where we can get out in local community events, where we can have community drop-ins, get out into GP surgeries. We're starting to do that much more. So that is a real focus. Because again, it's easy for people to volunteer if they know how or know how who to speak to, but certainly there's so many people that don't know, and we want to widen that out, definitely.
Yeah. Okay.
Just come back on that, because there's this assumption in the world today that everybody's on social media, and they're not. And the people that I volunteer with at the food bank aren't on social media. So you're right, it is about stuff in churches and in GP surgeries and that kind of thing. But I was just a bit concerned that ordinary people might not know. And I don't like that word ordinary, but people who don't have the connections might not know where to go to volunteer. And I think that's really important.
Okay, thank you. Councillor Mrs Clark, followed by Councillor Mr Clark.
Thanks for the report, Ben. Yeah, it's really useful, and there's been a lot of useful information in there. It's a hugely valuable resource, is volunteering, and I know from also working in my own division in St Giles, there's a massive volunteer support there. And I worry sometimes that the volunteers who work within the Methodist Church, and also they're there on a Wednesday and a Friday, and they're there with a food bank, they're supporting with clothing, people who just need to turn up and have a talk, and we sit there and we're available, you know, and just mix and have a coffee and talk. It's a wonderful atmosphere, but I often wonder the stress sometimes that volunteers are put under. They take on that role, they volunteer in that role, but they then have the stresses and strains of dealing with things that are upsetting, distressing, and I've come across that recently while I've been in St Giles. So really what I want to know is what are you going to do? What promotional awareness is going to be planned for 22-23? And do you also know which areas your volunteers most are attracted to go and work in? Because most people who want to volunteer, they do it because they want to help, they're kind, and then they talk to somebody and they say, oh yes, I'd like to do that. So I would like to see a bit more promotional awareness about volunteering and the opportunities that sit behind that, because it's such a valuable resource and I don't think we make enough of it. So I know they can contact you, but there are other things that are around that I think are vitally important, and we should now be promoting that and thanking them a lot more than we do, because without them, you know, there are some services and some communities just wouldn't be able to cope, because people, like Karen says, they're not all on social media, they don't know who to contact, they might come through to a switchboard, they might then have to go through several questions before they get to the right person. It's very off-putting, so it needs to be easy access. If you want to tap into this resource, it needs to be easy for people to do that, and they need to know where they can go to get the information. Thank you.
No, thank you. And I think, as you said, it's certainly the volunteers that do volunteer locally, they certainly from what I see in my village as well, once somebody gets involved in volunteering, ultimately they get involved in everything locally, and there is a lot of stress and strain that fall on a small number of volunteers. And I think, as we've seen through the pandemic, the needs of the people we're supporting are greater than ever, and it does take its toll on volunteers. And we've seen as agencies with the staff we've got on the front line, it does take its toll as well. So I think that what we're keen to do is look at how we can support both staff and volunteers in terms of that, and having that wider support network. But I think you're right in terms of the getting out and understanding what volunteering roles are out there. I think there's lots of causes that where people are have an affiliation with a cause, or they know why they want to volunteer, but there's lots of different groups and organisations out there as well. And I think historically or traditionally we've had lots of people that want to get involved in things like the Bransby Horses Home, and actually things that certainly outside as well. But I think there's so many different volunteer opportunities that people don't know are out there as well. So I think that's our role as a volunteer centre as well, to just explore why people want to volunteer, what their interests are, what the skills are, and try and match them up with volunteer opportunities that they might never have thought about. But I think it's not just about us getting out to new volunteers, but also get out to community organisations and try and help them think about, have they been supported by volunteers? Would they like any volunteer support? What that might look like? How we can help them develop different volunteering roles as well. So I think on the whole, we just need to get out into as many local events, local surgeries, and just have the discussions locally about the needs of both individuals and organisations, and because it has been so difficult over the last couple of years remotely. So yeah, I think that's certainly the way forward. Thank you.
Okay, thank you. Councillor Mr Clark.
Thank you very much, Chairman. It's pleased that you are going to use all media in order to get the word out, and obviously the payback the other way for volunteers to be able to contact. A question regarding training. Do we use e-learning in order that some of the volunteers can easily do that if that's available to them? And you mentioned earlier on that you'd got an increase in extra volunteers. Have we had any problems with security checks where necessary that's delayed the process of them becoming a volunteer?
Thank you. So yeah, e-learning, certainly over the last year, we've had over 200 volunteers that have been through some e-learning, generally around things volunteers would need to start volunteering, so whether it's health and safety, induction, equality and diversity, safeguarding, the general sort of stepping stones that people need to start volunteering. So so that is where the online training has been. I think we certainly widened it out, because what we were looking at initially was just new volunteers, but actually we recognise that lots of people are already volunteering in community groups and organisations would benefit from a lot of that refresher training as well. So it's not just been new volunteers, but also volunteers that are volunteering on an ongoing basis as well. Sorry, what was the second part to your question? I've just forgot about it.
Yeah, it was about where security checks are needed because of extra volunteers. Has there been a delay in the system?
There hasn't so much been a delay in DBS checks. I think there is a fine line between DBS checking and safeguarding. I think historically lots of organisations have done a DBS check to meet their needs around safeguarding, but actually there's lots more we can do in terms of assessing the risk around roles as well, and making sure that we're not putting volunteers in a vulnerable position. So part of our role as an organisation is to help organisations understand their roles around health and safety, safeguarding and risk assessments as well, so that we are limiting the risk. But now I think in general, there hasn't been a backlog so much of DBS checks. It has been more difficult for some organisations, because prior to the pandemic it was all paper-based, and we have switched to online for the majority of them. We have now got back to some paper-based DBS checking, but some groups have done it online, and if I'm honest, it's much quicker doing it online, but again, it's not for everybody, and for some organisations it does present a barrier. So I know that we have supported some organisations by going out and doing paper DBS checks where needed.
Okay, thank you. Councillor Gray.
Mr. Chairman, thank you. Ben, thanks very much for that very useful overview. And thank you, Ben, to your organisation, VCS and LCVS, for the great work you do, because you do sterling work in the community. But just going on from what my colleagues have already said, we do expect much from volunteers, and they often take on roles that were paid roles in the past, to be honest. And so therefore, training and support for volunteers is vital. I'm very encouraged to note the priority areas for volunteer centres going forward, so that's great. But I just had a question. I've seen Help My Street, the online platform, quite recently online. Is that proving useful to engage with volunteers? I just wondered how useful that is.
Yeah, thanks. So Help My Street is the platform that we used initially through the pandemic, primarily through the primary care networks, in terms of them having rotas for volunteers. So it very much works in a way that volunteers can register on there, they can see tasks and opportunities, and then they can choose them. So take the example with the vaccination programme, where volunteers were signed up as a vaccination. When the primary care network put on shifts on particular days, volunteers could sign up, and actually that worked really well. So I think we've seen pockets of work can work really well. What we're working on now is how it might work going forward. What we don't want to do is lots of volunteers register on there and have no opportunities to actually go on and tasks day in, day out to do. So we're working through that. We're working with colleagues at the YMCA through Good Neighbour schemes as well. I know they're trialling Help My Street for a project in Boston as well, to see the learning from that. But what we're also trying to do through the Help My Street platform, so when volunteers sign up for Lincolnshire Volunteers, to engage in one-off bits of volunteering, actually that they can also see all of the traditional volunteering opportunities that we have on our system as well, so that we're linking the systems together, so that we're having more opportunities for volunteers to see those more traditional roles as well. So yeah, I think Help My Street is very much a work in progress, but it is the platform that we're using for tasking volunteers moving forward.
Okay, thank you. Ben, on page 17, 1.12, the annual survey was completed by 162 people. We said on the previous page that over 3,000 people volunteer locally. If that is the case, that's only a little over 5% that completed the survey. What can we do to increase the amount of people in future years completing the survey, please?
Yeah, I mean, I think what we're starting to do in terms of some of the questions that we've asked in the survey, we're starting to ask these questions and gather the data as we go through with volunteers, because obviously lots of people that come to us to volunteer, historically we wouldn't necessarily ask what their volunteer motivations are, how long they've been volunteering. We would simply sit down, look at their skills, interests, and try and match them up. So we're trying to ask these types of questions in our everyday business and record that, so that we can build up a more effective database of volunteer sort of expectations, motivations, and support needs going forward as well. Because again, as we said, 3,000 people have volunteered, but a lot of them we didn't take telephone numbers, contact numbers. It was very simply matching them up very quickly, or signposting them to the local food bank, or whatever it is. So I think it was very much about pace and scale, particularly through the pandemic, getting people to where they needed to be quickly. And I think what we were trying to do with this survey is have it a bit more generic, so it was just a survey that went out there to potential volunteers and existing volunteers. So I think we're going to start to build that up, and I think as we go forward as well, if we repeat this or similar survey next year, I think we probably want to be a bit more targeted in terms of getting it out through some of our partners as well.
Okay, thank you. And just one more from me on 1.13, where it asks the survey asked respondents to provide the length of time they've been volunteering. 47% of respondents have been volunteering for over 3 years, which indeed you touched upon yourself and said some have been quite a bit longer. I'm certain that some would have been a lot longer than that. So just from your experience, what is the sort of length of time of the maximum volunteers? And just do you think that question is broadening out more in the future, rather than just how many has been doing it over 3 years, 10 years, 15 years, whatever?
Yeah, I think you're right, and I think we know lots of people that volunteer. They've been volunteering for 10, 15, 20 years, for their whole life really. So I think that's probably, we were really looking to see how the pandemic had changed. So but I think as we go forward, we might want to think about broadening that out as well, and see how that impacts on the way people volunteer. How do they, are their needs different because they volunteered for a longer period of time? And we might want to support them differently as well. So I think you're right, it does need some broadening out as we go forward.
Okay, thank you. Is there anyone else wishing no further questions? Okay, so the actions of this committee is to review and comment on the information contained in this report, and highlight any recommendations or further actions for consideration. I'm going to move that we receive the report and that we are satisfied with the current picture of volunteering in Lincolnshire and the identified areas of priority identified in supporting volunteer centres. Further, that we request that our comments and recommendations from today's debate, as recorded, are taken under consideration. Can members raise your hand if you agree to that? Okay, got everyone? Okay, thank you. Thank you, Ben and Lee. We'll now move to the next item, agenda item 6, which is the avian influenza outbreaks in Lincolnshire 2021 to 2022. This item is on pages 21 to 49 of the agenda pack and provides a review of the response to the avian influenza outbreak in Lincolnshire during 2021-2022 by the Safer Communities Trading Standards Service. This item will be presented by Mark Keel, who is the Trading Standards Manager. Over to you, Mark.
Thank you, Chair. So, yes, avian influenza was the main piece of trading standards, animal health and welfare work undertaken in the last year. I'm conscious of the fact that when we initially agreed to bring a paper to the committee, we were asked to give a general update on trading standards. So with your permission, I'd like to take questions on the avian influenza report, but just provide you with a very brief overview of some of the other work that we've undertaken this year.
Okay, Mark, that's fine. Yeah.
Okay, thank you. I did do a presentation. I've got some slides. Okay, so if we can just move that on, please. So, as a county council, we have a statutory duty to work with our local community to help them comply with laws that are aimed at preventing the spread of animal disease and protecting the welfare of animals. In Lincolnshire, this work is undertaken by the Trading Standards Service. We focus our activity in the following key areas. Disease control. So obviously avian influenza has been unprecedented this year, both at national and local level, and is a stark reminder of how animal disease can cause disruption to farming community.
Mark, if I could just interrupt, I can hear, okay, but I understand some of the members can't hear you very well, so perhaps your mic needs to be a little closer or something.
Closer. Okay. Yes, so disease control. So yes, the avian influenza outbreak this winter has been unprecedented at both national and local level, and is a stark reminder of how animal disease can cause disruption to farmers, the public, and lead to significant financial harm. We also have dealt with inquiries about rabies and imported pets, and we've undertaken a project on bovine TB, which I'll provide a little more detail about later. Animal byproducts is the failure to dispose of fallen stock quickly through an approved route, such as a rendering plant or knackers yard, and this increases the risk of disease spreading. Trading standards respond to complaints to ensure that there are no signs of any notifiable disease in the carcass, and that remains are removed promptly to minimise that risk. High-risk activities are those that pose an increased risk of spreading animal disease or causing welfare issues. Examples would be transporting animals about or bringing animals, vehicles or people from different premises together and then moving them on again. Prime example of that would be the livestock market at Louth, which we visit regularly. And we undertake an annual licensing inspection there with officers from the Animal Plant and Health Agency. We look at vehicles. These are inspected for compliance with construction and use requirements to ensure that they're properly maintained and to reduce the risk of injury. They are also checked to ensure that they're properly cleansed and disinfected to make sure or to reduce the risk of disease. Other high-risk premises in the county would include the rendering plant near Skellingthorpe. We have a number of knackers yards and maggot farms as well. Again, these are considered high risk and are inspected by our officers. A business may also be considered to be high risk because of their previous history of non-compliance. If we receive a lot of complaints from the public or partners, or veterinary input, or they're keeping incomplete records. And finally on that list there is animal welfare. So our officers do respond to complaints and inquiries regarding the welfare of farmed animals to ensure there's no unnecessary suffering. Our officers are not veterinary experts, and we do rely on input from the Animal and Plant Health Agency, vets, before we can take any formal action. So visits are usually carried out jointly. So the Animal Health and Welfare Framework has been developed by the Animal Plant and Health Agency, working in partnership with local authority officers from the National Animal Health and Welfare Panel. It's supported by the Association of Chief Trading Standards Officers and the Department for Food, Environment and Rural Affairs. The framework covers 6 areas: service planning, having a transparent complaints process, regional and national engagement, contingency planning and reporting, training and competency. The framework provides a set of practical principles that help local authorities deliver duties in a way that is responsive and accountable to our local communities. It focuses on high-risk activities to make best use of our limited resources and recognises why national consistency is important for business, the public, and to protect against animal disease. It delivers the controls in a way that supports European and international trade agreements and promotes collaborative working with all the local authorities, delivery partners in the industry. Move on, please. Our activity is based, our activity is planned and summarised in the Animal Health and Welfare Plan of Activity, which is based on the framework agreement. It identifies both national and local priorities. In 2021-22, the planned activities included having a risk-based inspection programme, officer training. We looked at enforcement and licensing, the intelligence that we hold and gather, emergency planning and national priorities. So looking at the inspection programme, to ensure limited resources targeted at those premises most at risk of non-compliance. An inspection is drawn up comprising of high-risk premises and medium-risk premises which have current issues. The risk assessment of animal health premises is reviewed annually by my colleague Barbara here and is reviewed throughout the year as visits are completed or intelligence is added to the database. 25 premises were selected for inspection and we have completed 23 of those. The remaining 2 are scheduled for this month. 95 inspections were carried out in total, including programmed when visiting premises for other reasons such as feed hygiene, visits carried out in response to complaints. So of those 95 visits, 51 were visits and revisits to those 23 premises. The results of those were 24 of those visits we found the premise to be compliant and no action was necessary. Of the remainder, 17 were dealt with by advice. We had 5 written warnings where more serious non-compliance was identified and 4 of those have resulted in an investigation. Of the remaining 44 complaints or where officers were visiting for other matters, 18 were found to be compliant and no action was necessary. 13 resulted in advice and 13 written warnings have been issued for more serious non-compliance. Okay. The photo is in relation to a particular incident at one of the high-risk premises. We've conducted multiple inspections there in the year and identified potential offences for a formal investigation to be instigated. However, conditions deteriorated and with a vet deeming all animals on the farm were being caused unnecessary suffering or were likely to suffer if conditions did not change. The suffering was a result of unsuitable housing. Buildings on the farm in a serious state of disrepair posed a risk. There was inadequate feed and bedding, as you can be seen in that photo. Pigs would usually be expected to have a dry area, and one's not available there for them. And there was a lack of veterinary treatment and care for the sick and injured animals. If we can move on. So again, another example. We ended up taking those animals away from the premises. We could have seized them. We had the power to do that once unnecessary suffering was identified, but we worked with the farmer. He agreed to sign them over into our care. So we're currently dealing with the remainder of the 225 pigs that were taken into our care. They will be sold on to recoup some of the costs that trading standards have incurred. This is an ongoing issue that we're sort of concerned with as farmers. Some farmers are finding the trading conditions quite difficult, and this is one of the problems that can occur as a result of that. They can no longer afford feed or proper care for the animals, and there is a risk that we end up having to take them under our wing, as it were, to ensure that there is no unnecessary suffering. So the photos that follow are just what happens with the pigs once we've taken them. This is obviously a more suitable environment for them, and obviously they're being cared for properly. Okay. So enforcement, training. Just quickly mention training. We identify training needs for our appraisal process. All staff were updated on avian influenza prior to the outbreaks in Lincolnshire. We did recognise that that was a potential problem early due to the number of cases that were occurring nationally. We've also provided training on illegal landings and animal welfare in transport markets and on farms. For the enforcement and licensing, we've had 564 complaints this year. Of those, 199 related to breaches at abattoirs. 67 arose out of the avian influenza pandemic, and 59 in relation to animal welfare, and 17 dead stock. We treat all complaints seriously. It's dictated by our duty officer guidance, and we often work jointly with Animal, Plant and Health Agency in responding to welfare complaints. As I've alluded to, we're not experts and we do need that advice. The county has 6 large abattoirs and several smaller ones. We are responsible for enforcing the welfare and traceability of animals entering the food chain. This continues to be the highest category of complaints we've received, and they're mainly regarding animal welfare. So injuries, illness, trapped birds, or animals that are heavily pregnant when they're submitted for slaughter. We have a few relating to identification and traceability. As the animals are usually travelled from outside of Lincolnshire, these complaints involve liaison with other local authorities to ensure appropriate action is taken, such as follow-up visits and inspections to farms and the transporters who are taking the animals. We're currently investigating one such complaint, which was in relation to the identity of a bovine being switched. As a result of the investigation, several other animal health non-compliances were found on the farm relating to bovine TB and breaches of standstill rules. Whilst we no longer license the movement of animals, we are responsible for investigating any breaches related to animal movements. Since 2001 and the foot and mouth outbreak, movement standstill rules have been in place, and this year we've had 72 reports that have been investigated, resulting in 14 people being given advice and 25 warnings being issued. We often find that a high proportion of those breaching these rules are new keepers who are unaware of the standstill requirement. We used to have a dedicated team of animal health officers who would routinely visit all new keepers. It would be nice to bring that back, but unfortunately we don't have the resources to do that at the moment. So some of them do find their way onto our inspection programme. And we currently have one formal investigation in relation to a repeated failure to follow standstill rules. As I mentioned, we do record our own intelligence, and we do have access to other sources, including a national intelligence database that flags up anything relevant to Lincolnshire and Lincolnshire's traders. It's especially useful in areas such as the importation of puppies and dogs and the selling of those through various social media sites where operators are trading across several counties. We also attend a regional group for the East Midlands. It meets quarterly and we share information with our colleagues in the region. As part of our emergency planning response, we have reviewed the avian influenza plans this year whilst we're undertaking the outbreak response. We've also reviewed the county's emergency response to flooding in respect to livestock. And finally, the national priorities, illegal landings. We've only dealt with 3 illegal landings this year, but it continues to be an area of national concern. We are responsible for ensuring that dogs and cats and other mammals which enter the country have had the required rabies vaccinations and checks and have the correct paperwork issued so this can be verified. We are seeing an increase in other zoonotic diseases. These are diseases which can spread from animals to humans, from pet animals imported into the country. And these would include things such as tapeworms, nipper disease, Hendra disease, and brucellosis canis. Of the 3 complaints we received, 1 dog was actually placed into quarantine and is still currently there at the moment. And finally, bovine TB. It's estimated to cost the taxpayer around 70 million a year to tackle the disease, with cost to farmers running to a further 50 million. Although Lincolnshire is predominantly a low-risk area for the disease, with herds being routinely tested every 4 years, there are additional controls when animals are brought into Lincolnshire from high-risk areas. These include what is known as post-movement tests. Any animal moving from a high-risk area to a low-risk area must be TB tested between 60 and 120 days after arriving. This is to ensure any animals carrying the disease are identified before the disease has time to spread to other animals in the herd. After receiving an increasing number of notifications about farmers not carrying out these tests, we set up a project this year to look into this area further. Working again with the Animal and Plant Health Agency, we found that Lincolnshire were receiving 4 times as many referrals as other local authorities in the East Midlands area. In the 12 months to September 2021, the total number of referrals was 83 and it covered 28 different holdings. Again, working with Animal Plant and Health Agency intelligence officers and vets, we looked at the top 10 repeat offenders, taking into consideration other animal health concerns such as high mortality rates on the farm. As a result, visits have been carried out to 4. These have uncovered other issues around welfare and record keeping, and work continues on 3 of these premises. Letters of advice and warnings were sent to the remaining 6, and we have, if we have any further non-compliances at these premises, they'll be investigated moving forward. In addition, this year we're planning to contact farmers after we receive a notification of a post-movement non-compliance to offer support and guidance at an earlier stage and hopefully avoid repeated non-compliances. Visits will also be made to the premises who have had non-compliances in the past 24 months that didn't hit the top 10 this year. It's a very brief update of the work we've undertaken, but if anybody has any questions.
Thank you, Mark. I'd now like to invite members of this committee to comment on this item. I'm aware Councillor King wishes to speak. So over to you, Councillor King.
Yeah, thank you, Chairman. You were saying about training and what have you. When you advertise for future trading standards officers, why don't you start aiming at perhaps ex-veterinary nurses who've got the veterinary experience, ex-RSP, not that I actually like them much, ex-RSPCA inspectors, things like that, because that would, in-house people are a lot better than getting people in. There's a couple of other things as well, but I'll let you answer that one first.
Yeah, it's certainly something to consider. It's an important part of our work, but it's also a relatively small aspect of our work as well. But we do have an employee who is an ex-veterinary nurse, so we do attract people from that background. But it's certainly something that we can consider putting in the future.
Okay, thank you.
Yeah, I mean, the other thing as well is I think animal welfare comes a bit far down the list, and as an ex-veterinary nurse myself and smallholder, yeah, it does worry me. I mean, obviously, avian flu, has there been many prosecutions, people not following the rules, you know, either housing, netting, so birds can't, because I think there's an awful lot of backyard chicken keepers who think, oh, they're not going to be bothered about mine, but we still feed the wild birds in our gardens.
Yeah, I think where we receive the complaints about those, obviously we spent a lot of time trying to get the message out that people do need to house the birds as soon as that countrywide prevention zone is put in place. And we do try and use as many avenues as we can to get that message out. But if people do make complaints about neighbours or birds that they see, we do follow those up. And generally speaking, when we speak to people, it is a lack of awareness. and once people are made aware, they do tend to get matters sorted. We haven't had to prosecute anybody yet, but it is ultimately an option for us if people don't ultimately comply.
Okay, thank you. Councillor Mr Clark.
Thank you, Chairman. I thoroughly enjoyed reading your report on the bird flu. Not that it's a good subject to really read about, but it was quite intense and lots of information stored there. I've got a couple of questions, if I may. Once a farm has been cleared and all the stock's taken away, when can they reintroduce stock to the farm?
Yeah, I'll just pass you over to Barbara, who's a bit more expert than I.
Hi. That's sort of outside our remit. That's Animal and Plant Health Agency follow that up. But basically there's a protocol that they have to follow. The farm premises are fully cleansed and disinfected by Animal and Plant Health Agency staff initially, following the removal of all the birds. And then following on from that, there's a secondary cleansing and disinfection carried out by the premise. And then once that has been assessed by Animal and Plant Health Agency staff, then they're free to then restock. But we're talking several months. I don't think any of the farms in the current outbreak have restocked yet. It's a long process to make sure that the premises is fully suitable and there's no, danger of any disease still being on site. Thank you.
Yeah, I know it's not a nice subject to talk about, but I read it was 1.2 million birds have had to be disposed of. Can you tell us how they're disposed of?
Yes, they'll be disposed of through one of the routes that Mark outlined in his report, that it has to be an approved disposal route for diseased animals, and we have one of those in Lincolnshire. We've got the rendering plant, which would have taken some of the birds, but again it would depend on across the country where all the outbreaks were at the time, and they had several sites designated across the country to dispose of the birds, but most of them would have been rendering plants or incineration plants that are specially approved to dispose of diseased animals.
Okay, thank you very much. It was good to read, in fact, about the coordination that the various working groups of trading standards, police, fire rescue and highways. Presumably there was somebody coordinating that, or was it something that's already set in motion and it's just, as it were, pressing a trigger and everybody comes together to work through this crisis?
As much as I like to take credit for it, I think Barbara did most of the coordination for that. We do have a contingency plan there, and as soon as we are notified of a potential outbreak, then we can start to run with the plans that we have. We can make contact with colleagues and in other services to make sure that we've got the signage to put out, that highways put out for us, to make sure that we've got appropriate premises where we could operate from, which the fire brigade kindly assisted us with this time. So it's there and it's ready to go. It's just a case then of as soon as we're notified, getting on the phone, ringing round and making those arrangements. But we've had outbreaks previously on a much smaller scale, so we've had time to sort of prepare to know who we need to be in touch with, and it did set us in good stead this time, because like I say, this year was quite unprecedented in the scale, both locally and nationally, unfortunately.
Thank you for that. I noticed that in your report you said 210 days were lost. Yes. Of officers' time. Is it going to be a slow process to try and catch that up? Is it a possibility you could maybe take on, like the lady mentioned then about recruiting? Do we do a short-term contract? Do we look at trying for apprenticeships, as it were, to have a backup that we can always cover? I know you can't work in every criteria and every emergency that could possibly crop up, but should we have a bit more spare capacity within our staffing?
Ideally, it would be nice to have some extra capacity, but obviously we are constrained by our resources in that way. We did go out to colleagues in other services and ask for some assistance, which did free up some of our officer time. But it's I suppose the other alternatives take a bit longer to do the work that we did. To keep a few more of the services running in-house, but we took the decision that it was best to get this dealt with quickly and efficiently. So we kept a skeleton staff there to undertake the work, but we committed as many officers as we could, or we felt we needed to respond as quickly and as efficiently as possible. But I do take on the point, it would be nice to have a pool of people. Maybe we could speak to the voluntary service to see if there are people that we could train up to assist us if this were to happen again.
Okay, thank you. Councillor Brockway.
Thank you, Chairman. I apologise for my lateness. The roads were closed everywhere, but thank you. Thank you for the report. It's very, very interesting. So much in there that I didn't know anything about. I have two questions, if I may, please. We're talking about the disposal of all these creatures. Now, what we're talking about, is a life. Each one of those disposals is a life. So how do we actually ensure that suffering, and particularly fear, in the birds are kept to a minimum? Is there an oversight of that? And if so, who does it? Please, that's my first question, okay. Chairman. Thank you.
Again, that's the culling of birds is dealt with by the Animal and Plant Health Agency, so we aren't involved on the actual premise itself in that side of things, but that is fully overseen by them. They will bring in contractors to carry out that work, but they will be fully supervised, and there will be appropriate contractors, who work in that industry. Again, touching back to the contingency plans, farms themselves and the Animal and Plant Health Agency all have contingency plans in place, so if they have to carry out a culling on site for whatever reason, they have those plans in place and they've identified the most humane ways to do that, and they've all been assessed by vets that they are humane and that is the best circumstances in which to carry them out.
Oh, that's fine. Thank you. Also, I notice that the report points out that this virus mutates frequently. What is the potential for it to mutate to humans? Because we do know that a number of animal viruses do mutate to humans. I don't know if it's the same with avian viruses. But I take it that that's part of the awareness when we send people in all the time. Thank you.
Yeah, that is one of the big concerns about avian flu. There are several strains that have happened across the world that have already, mutated and affected humans. So that is one of the concerns and one of the reasons why, you have to deal with the disease very quickly and efficiently. Any staff that are working on the infected premises will all have the Tamiflu vaccinations before they go on, and they're all assessed, so anybody who's unwell would never be sent on. I think there was one case this year where it wasn't in Lincolnshire, but there was concerns that somebody who was on an infected premise had caught bird flu. So, it's something that is very prominent in all the controls, and also the human health side is also, a major consideration in these cases.
Thank you. No other speakers. Just on page 45, Mark, clearly we have the highest number of cases in England, or we certainly did. Is there any clear explanations as to why that should be?
Generally speaking, it would be down to some form of poor biosecurity measure in place. Now, whether that's the premise having it's not secure, wild birds can access the stock, or whether it's people trailing the disease between premises because of they're working on different units, and the biosecurity measures haven't been as robust as they could be. So cleansing, disinfection, that type of thing hasn't been as well done as it could be. And that, I would say, is the likely cause of cross-contamination between those sites, rather than access to wild birds, because some of them are sealed units, quite good in construction, some of them less so, but I would say poor biosecurity measures.
And just one more, Mark. What stage are we at right now in Lincolnshire? Is all those cases now been dealt with and we're now clear, or is other cases emerging, or where are we at right now?
We currently don't have any cases. All the cases have been closed now, and all the restrictions lifted in Lincolnshire, and we had one in North Lincolnshire and that fell into Lincolnshire, and that's all been lifted. So we haven't had any suspect cases either, so we've got nothing pending. There are still a few new cases popping up nationally, which is why there's still a national prevention zone across the country, which requires all bird keepers to keep their birds housed, because they still felt that there is a risk there. But there haven't been any new cases in Lincolnshire since the end of January.
Okay, thank you. Now, if I was reading Councillor Kingrad, I think you'd like this to come back at a later date, the report to come back. Is that okay with yourself to come back? And if so, what sort of timescale would you think was suitable?
What would you like us to cover when we come back?
Councillor King, would you like to elaborate on that?
3 to 6 months, something like that.
And any particular aspects of it you like to?
Well, there's a lot. I mean, I think you know me well enough that animal welfare is fairly high on my agenda. Most of it, I mean, avian flu, fortunately now, is hopefully dying down in this area. There's still an awful lot of importations of dogs, cats, other things coming in from abroad, which are a real worry because of the rabies aspect, one of the worst things that we could possibly have. So those sorts of things really, and generally training aspects. I'd like to know more about the training that people get in this field, please.
So I think, Mark, a bit of an overview, and can I suggest 6 months' time?
Yeah, that's no problem at all.
Okay, thank you. No further speakers. Okay, so the actions of this committee was invited to consider and comment on the report and highlight any recommendations or further actions required. So I'm going to move that we endorse the report and that we're satisfied with the level of assurance provided by officers, and request that our comments from the debate are taken under consideration, and also that an additional report is submitted containing detailed information relevant to animal welfare in 6 months' time. Can members please your hand if you agree with that proposal? Okay, all agreed, thank you. And thank you, Mark and Barbara.
Thank you.
Next item on the agenda, item 7, is Her Majesty's Inspectorate for Constabularies and Fire and Rescue Services, report for Lincolnshire Fire and Rescue. This item is on pages 51 to 81 of the agenda pack and provides a summary of the Inspector's report on Lincolnshire Fire and Rescue as part of the national inspection regime for all fire authorities in England. The item will be presented by Mark Baxter, Chief Fire Officer, via Teams. Are you there, Mark?
Yeah, hi, Councillor.
Okay, over to you.
Hi. Hello all, and thank you for the time for me just to run through the report from our inspection. So this was on the back of our the National HMI inspection that we had back in April and May of 2021. The full report wasn't released until the 15th of December 2021, so that there was a a fair amount of delay in regards to until we got the findings of the report. That was based on the fact that actually there was 13 services that needed to be inspected during tranche 1. And HMI won't release any reports until all services in that tranche have been inspected. So it gives a more of a flavour of how services are doing as a group. So just a little bit of background in regards to how the inspection gradings work. We are inspected under what's called 3 pillars. One's effectiveness, one's efficiency, and one's about people. The effectiveness is about how we keep people safe and secure from fire and other risks. Efficiency is about how we ensure that we've got the right resources to keep the people secure from fire and other risks. And people is about how we ensure that our people are adequately trained and supported to ensure that they can do the business appropriately. So this was our second inspection that we've had. We had the first inspection under the new HMI regime was back in 2018. Under the 3 pillars in 2018, we got a good in effectiveness, good in efficiency, and requires improvement in people. In this inspection, we got requires improvement on all 3 pillars of effectiveness, efficiency, and people. If I can just quickly break that down, what that means is there's actually 11 subjects, is probably the best way I can describe it, under all of those pillars that we get judged on. In overall, the movement of our gradings, out of those 11, 6 of them have actually stayed static. 4 of them have gone down a grade and 1 of them have improved a grade. The grades that you can receive are either inadequate, requires improvement, good, or outstanding. I think it would be pertinent for me to identify that actually we didn't receive an inadequate in any of our gradings whatsoever. So although there are some areas that we requires improvement, the HMI have recognised that we're not inadequate in any area of our business. To put it into context, for the 13 services that got inspected at the same time, 7 of them received the same gradings that we did across the whole of the inspections. Only 1 service gained an outstanding judgment. So I think in regards to a benchmark, we're pretty much in the same ballpark as most services. So if I could just probably touch on some of the summary of the findings in regards to effectiveness, which is about how we respond to our communities to make sure they're safe in regards to fires. There's really lots of positives within the narrative of the report. In regards to our community risk management plan, which is the new version of the integrated risk management plan. They've recognised this as a really positive document, recognising actually we've been able to identify the risks and how we're mitigating the risks in regards to our communities, which is going to give us a good plan for the next 4 years on what we need to achieve. It was identified that we just need more work to do and how we can align our resources to achieve these plans. There's really positive about our mobile data terminals, ensuring that we've got adequate and appropriate ways to ensure that we've got valuable risk information in a timely and accurate way so that our crews can have access to the information. Prevention activities and how we meet our most vulnerable and hardest to reach communities was much improved, although there does improve more understanding of where these people are. And we'll do more work with our partner agencies to increase this intelligence. There needs to be a greater evaluation of the impact of our prevention work. Now, interestingly, at the time of the inspection, we'd had already commissioned a work with the University of Lincoln, which they did a comprehensive study in regards to of our prevention activities and the impact, and I'll touch on the outcomes of that later on in the report. But unfortunately, at the time of the inspection, that report wasn't released. It has now been released, and we're now working against those recommendations. I'll touch on the cause of concerns a little bit later, but some of the other areas that were recognised in this area of effectiveness, there was a recognition or a concern about our resourcing our skills to meet our protection activities. And now our protection activities is ensuring how we support our businesses and commercial activities to ensure they comply with the relevant legislation and ensuring that they are safe businesses. Again, we have done work since and during the inspection in regards to recruiting and training more staff, so we are in a far better position in regards to that. But it's also worth noting that it was identified that none of our actual statutory duties that we are obliged to undertake, they are all being done and completed and within the statutory requirements for Lincolnshire Fire and Rescue and Lincolnshire County Council. So again, it's positive that we are meeting all of our statutory duties. And then some other positive areas that how we respond to fires and our emergencies. This was rated as good within the report. It showed that we had good response standards and availability with an average of 86% availability. And this is against the national average of 83%. We had response times is an average of 10 minutes and 20 seconds, which is quicker than the average of 10 minutes 27 for other rural services doing a like for like. It was stated that our response targets hadn't been met. This was largely to do with the fact that we set ourselves quite a stretch target of 100%. And although we was meeting our response targets in the high 90%, because we stated we would reach it in 100%, it was stated that we hadn't met them. We have reviewed these targets for this current year to ensure that they are far more reflective and realistic in regards to how we respond to our communities. It was noted that all of our crews and officers were appropriately qualified and trained, and demonstrated that where people were going out of date on their training competencies, they were removed from those tasks until they had completed that training, which shows that we've got good assurance and good scrutiny over in regards to our operational competence. And again, we was rated good in regards to how we respond to emergency service, major events and major emergencies, particularly in regards to how we work as a key part within the local resilience forum. As I touched on earlier, it was in this section that we got our cause of concern about our protection delivery. And this was in regards to that they stated the service hadn't took sufficient action since the last inspection to approach resources protection function. We did have the 3 recommendations which are in the report, but again, I'm going to touch on a bit more detail later on that, so I don't want to repeat myself. But because we had a cause of concern in effectiveness, that is reasons why the whole of the pillar will always state as requires improvement, despite the fact there was lots of other positive outcomes from the actual effectiveness pillar. If I can just touch on efficiency, again, this is in regards to ensuring that we've got the right resources, we've got good financial assurance scrutiny, and where we are resourcing the right areas to ensure that we can deliver our business. Again, it recognising the benefits of our community risk management plan that I identified, the priorities and foreseeable risks. But again, it was just recognising that there's more work for us to do to specifically identify the resources we're required to deliver against that. There was some really positive recognition about the work and support from Lincolnshire County Council, offers in terms of alleviating financial pressures to balance our budgets. It was recognised the improved working with external partners, particularly within our blue light partners and collaboration. But it does state there's more evaluation needs to be done so we can realise the benefits of these arrangements. And although it mentioned that we have got, we do work closely with LCC in regards to our medium-term financial plan, there probably needs to be more work done for the longer-term savings plans, which we are obviously continually working with Lincolnshire County Council in regards to our financial planning in regards to future funding. But the report did found that we was good at making Lincolnshire Fire and Rescue affordable now and for the future. It said we got a well-balanced budget, it was being well-funded capital programme, and it was supported well in regards to Lincolnshire County Council in terms of the reserves and investment in fleet and estates. And then the third pillar this was about our people. Again, what was really pleasing that it was recognised that the culture and the behaviour of the service had improved since the last inspection. This is particularly pleasing that they recognise this as actually this is from direct feedback from our own staff through surveys and through interviews that they had done throughout the organisation when they came in to inspect. Some of the headlines are in the report, but over 90% staff were aware of our values and behaviours. 83% said they were treated with dignity and respect, and over 70% said that the senior leaders modelled the values and behaviours. The work that we've been doing in regards to mental health awareness and accessibility has clearly been recognised, as over 95% said they were able to access these services when required, and 98% understood the health and safety policies. Without me going through all of the list there, I think it's just pleasing to recognise that was the area where we had made improvements since the 2018 inspection in regards to our culture of the organisation. And so again, I just want to reiterate, it's pleasing that HMI did pick up on that. HMI did recognise that there's probably more work they need to do to ensure our trainers are qualified in assessing against skills in risk critical areas. This has been a recognition that we've had a relatively high turnover of staff within our central training department. All of our trainers are qualified instructors and they are all trained in regards to the skills that they deliver. We are just finishing the completion of assessment training, so ensure that they can then quality assure and assess the instructors that we have now being put in place in the training department. So that is an area that we have been already addressed. And then within this section, this is where we got our second cause of concern, and this was in relating to equality, diversion and inclusion. And the HMI stated that the service hadn't done enough since the last inspection to improve its EDI. Again, I just want probably just to put that into context. What there really was the recognition was that actually we needed to do more to ensure that there was a greater priority and there was a greater awareness of what EDI meant within the organisation and how it can benefit everybody within the organisation, and what steps we needed to do to improve that. But again, I'm going to touch on both of how we're addressing both of those cause of concerns in the next section of the report. There was good recognition that there's an improvement in our grievance procedures, and also that personnel had better understanding of PDR processes. Or in regards to PDRs and one-to-ones, we've also launched a new programme to ensure that every member of staff, whether they're whole-time, on-call, green book, grey book, receives at least one PDR a year, and we have implemented more regular one-to-ones to ensure that everybody does have a link in with their appropriate line managers. And the recognition that there needs more to be done for us to recognise and give avenues for high performance leaders and high performing staff to ensure that they've got progression within the organisation. And also there needs to be more succession planning for senior leaders. This is an area which is a sector-wide issue in regards to workforce planning, as there's been a significant turnover of middle managers and senior leaders throughout the whole of the fire sector within the country. So this is an area that is being addressed both nationally, but also within Lincolnshire Fire and Rescue. We've put a dedicated strategic resourcing board to look at our future workforce planning issues that is beginning to work through these challenges for the future. So really, what have we done to address these areas within the report? So to touch on the two cause of concerns, once we got the details of the cause of concerns, we put together dedicated action plans. I took the lead in regards to the EDI action plan, and I put together an EDI steering group. And within this group, we've had an action plan that we've been sharing with HMI on a monthly basis, where we also meet as a group on a monthly basis to ensure progress and actions are being delivered by. And we also ensure that this is reported into our quarterly performance management board. And this is to ensure that our service leadership team and our executive councillor has clear oversight and scrutiny in regards to our direction of travel, and to ensure that we are meeting all the needs against that action plan. Also recruited in an officer from Derbyshire Fire and Rescue, a lady, Davinda Joel, who is a specialist area within EDI that she's been working closely within Derbyshire Fire and Rescue. She was also used to work for HMI, and she was also part of the inspection team that came into Lincolnshire Fire and Rescue, so she knows Lincolnshire Fire and Rescue quite well. And she's been giving us some really good, useful peer feedback in regards to how we can develop our EDI strategy and how we can deliver that has actually paid dividends in regards to some of the work we've been doing. And also we've made sure that we've got representation on the LCC's corporate diversity steering group to make sure that LFR and LCC are extremely linked in regards to the delivery of EDI. The outcome of the work that we've been doing during that action plan is that HMI I use the word happy and content in regards to our direction of travel. They are pleased in regards to the progress of the work that we've been doing in regards to EDI. And when they came and did a re-inspection a couple of months ago, they were satisfied that the work that would already been done, to the point where they don't want to come back into Lincolnshire Fire and Rescue to see further work in regards to how we're delivering against EDI. They are content to just inspect us in line with the next full inspection, which we anticipate probably to be between 18 months and 2 years. The biggest area that we've developed in regards to EDI is that we are rolling out, when we started rolling this out in March, is a full foundation training programme. So every member within Lincolnshire Fire and Rescue are having face-to-face interactive training from an external agency in regards to understanding and awareness of how EDI benefits each and every one of us. And that's going to be our foundation training, which will then be followed up by maintenance training and accessibility to the EDI agenda that will ensure that everybody within the organisation does have the awareness that is required. And then if I can just move on regards to the protection action plan, again, that's been led by ACFO Ryan Stacey. And again, in very similar format, put together a dedicated action plan, which again has been reported on a monthly basis to HMI. It is also feeds into our quarterly performance management board, again, to ensure we've got senior leadership team and executive councillor oversight. We also produced weekly updates to our executive councillor and executive support councillor to ensure that to give them the confidence in regard to our progression of how we deliver on our high risk inspection programme, which was one of the main areas of concern for the HMI. And the progress that's been reported back from HMI, again, from when they came in and did the re-inspection, is that they were really positive in regards to the direction of travel of how we are delivering against risk-based inspection programme. The challenge that we've had in regards to delivering the stated risk-based inspection programme has been due to the fact that although we had the right amount of personnel in place, it takes up to about 18 months to ensure that people are appropriately trained and qualified to deliver the full audits and inspections that is required. So we've ensured that we've had to fit in almost 12 months worth of inspections into a 6-month period. So, and I think it's recognition of the work and the dedication of the team that they've worked tirelessly to ensure that we came to April with our all of our audits either completed or that were booked in to be completed within the first 10 days into April. And I can confirm that all of our risk-based inspection premises have been audited as per our own inspection programme. What we've also been doing during this time is to ensure that we've reviewed our future risk-based inspection programme. Now, I think what's important to recognise is prior to last year, there was no national standard in regards to how and who and what premises we inspect. It was left for individual services to risk assess this and state what we classify as high risk. Since then, the National Fire Chief Council, which we've been working directly with, have now produced the appropriate guidance to ensure that there is a consistency across all fire and rescue services. And for this year, for 2022-23, we have now adopted this standard, which actually means that there are less high-risk premises that we need to inspect, and that ensures that we've actually got the right amount of resources and qualified personnel to ensure that we can inspect our risk-based inspection programme and also our medium risk premises with sufficient resources that will allow us to ensure that we can also deliver on our statutory duties, but also ensure that we can develop our staff into other areas of protection to ensure that we can do what we can to keep our premises and our community safe in regards to the protection agenda. There's been several areas that we've been working alongside in the protection. I think most notably has been the work that we've been doing with the National Fire Chief Council. And I think, again, I think it's credit to the team that they've been an integral part in developing that national standard that ensures that actually has put us at the forefront of the future delivery of our protection. So we are now in the position where we are confident that our future inspection programme will be met. The HMI were really keen to see how we are going to progress with our new risk-based inspection programme. So they will be coming back into the organisation in approximately 6 months' time to see how we are delivering against the new risk-based inspection programme for this year. So we are looking forward to and welcoming when HMI come back into the service so we can show them the evidence and the improvements we've made in that area. My final area in regards to the two quarters of concerns, as I mentioned, they came in and did a full inspection on those two areas. It was nearly 2 months ago now, and we are expecting a formal letter that should be arriving, and it's unfortunate that it is being delayed because I was expecting the letter to have arrived prior to this scrutiny meeting, but I've just had confirmation this morning that we should be getting a letter this week. And the letter will be confirming the findings of the re-inspections, but the flavour of what we are being given so far is of the fact that they are really positive and pleased in regards to the progress we've made in both of those areas of the cause and concern, and they are looking forward to seeing the continual direction of travel. But the work that we've done so far is putting us in a really positive position in regards to those particular areas of their cause of concerns. And then in regards to the wider area of the report, there were in total 17 areas for improvement across all three pillars. Within the report on pages 57 and 58, they bullet pointed what those 17 areas for improvement are. So clearly what we have done, we've also set up a bespoke action plan to ensure that we can address all of these causes of concern, to ensure that we are going to be best placed for the next round of full inspections. This is managed within our performance management board. It is all logged onto our performance software, which is in phase. So all allocated managers, both at tactical and strategic level, have oversight, are able to input and update, and also ensuring that we've got executive council oversight in regards to the progression of those areas for improvement. A few bits of flavour of work that we've already completed in regards to their areas of improvement. Within our prevention work, we've done work with our community risk department to ensure that we've got far better data and analysis of our vulnerable and hard to reach communities. This has resulted in dedicated prevention advocates and operational crews now delivering targeted prevention work in areas that meet our Sherman criteria. But also it focuses on local area demographics, such as the Eastern European communities and caravan communities, which particularly our East Division colleagues have been having a clear focus of that targeted work. I touched on the prevention evaluation for the work that we've been doing with Lincoln University. So they completed a really robust evaluation of the benefits of our prevention activities, and some of the summary headlines is that the social return on our investment indicates that for every £1 spent on self and well checks, we receive just over £38 worth is accrued, and that's in regards to the benefits for the communities and how it's preventing areas such as if people would have responded in the event of fire, preventing fires from happening in the first place, or limiting the spread of fire. The majority of our safe and well checks resulted in some changes in service users' understanding of fire risks and their willingness to use this information. There was information from medium risk service users was sufficient for their need, and although some high risk service users may require additional support, irrespective of risk categorisation, over 51% reported that there was a reduction in the risk of fire, and 49% maintained the risk-free level of safe and well checks. So there was no deterioration in the level of risk following our safe and well checks. There was over 86% in service satisfaction of our safe and well checks, and again an area which is really important for us. Service users recalled having smoke alarms fitted and receiving other types of fire-related advice, because we know that the fitting and the use of smoke alarms is a lifesaver in regards to fire prevention. Other areas where we've improved, particularly in regards to the efficiency pillar, this was having a clear link of our fleet programme and our fleet strategy against our integrated risk management plan. We've completed a full fleet strategy over the next 4 years that we've aligned directly against our resource requirements to meet our risks. We've also ensured that we've done this in conjunction with the environmental sustainability agenda, and our fleet strategy is being ratified by the LCC Corporate Environmental Sustainability Board, which is chaired by Andy Gutherson, to ensure that our fleet strategy not only meets our needs for the next 4 years in regards to operational support and response, but also it meets the environmental agenda as well. Within the people pillar, we've done an awful lot of work in regards to launching and embedding our culture agenda, which is summarised within Thrive. But Thrive is a mnemonic that stands for trust, help, respect, include, value and empowered. Now, Thrive is really important for us in regards to how this has been brought together and delivered, because actually this is where we went out to our staff and we engaged with them and asked them what is the values and the behaviours that you expect us to operate in, and what do you expect us as Lincolnshire Fire and Rescue to behave on our day-to-day in our day-to-day business. And the words trust, help, respect, include, valued, empowered were the overwhelming responses. So we made it a commitment as a senior leadership team to our staff. Well, if that's the behaviours that you expect as an organisation, then we will sign up to them as a leadership team, and we will ensure that actually this is going to be the basis of our culture for Lincolnshire Fire and Rescue. That has been launched within the organisation prior to the inspection, and actually within the recent LCC staff survey, that gave us evidence that there's over 87% was positive feedback in regards to our Thrive concept within the service. again, they're just some summary elements of some of the work that is ongoing. The purpose that I wanted to outline some of the work and the progress that we've been made against the inspection is to hopefully to give some assurance and confidence to the committee that actually we've got some very clear action plans that are embedded within our performance management structure, and with the support of the executive councillor and through the leadership team. This is part of one of our high priorities that we've stated for 22-23 in regards to our annual plan, to ensure that we can deliver against our full HMI action plan that will enable us to not only improve as an organisation, improve as a service, but also will put us in a far stronger position for when the HMI do come back for a full inspection in approximately 18 months to 2 years' time. But ultimately, and this is something that we do impress upon through everybody in the organisation, ultimately, this is about us making sure that we are the best organisation to support the needs of our communities of Lincolnshire. And although there's an awful lot of work that is being done that seems to be directly because of the HMI's recommendations, the whole of that golden thread still fits into regards to what our purpose for Lincolnshire is. Lincolnshire Fire and Rescue is to ensure that we can keep the people of Lincolnshire safe and well. And that's why we are absolutely committed to continuing with our action plan to be the best service against the HMI recommendations. Councillor Pepper, if it's okay, I'm happy to pause at that point because I'm conscious I've probably done quite a whistle-stop tour of that report. Happy to take any questions on regards to that point.
Thank you, Mark. I'm not surprised you stopped for a pause there, but thank you for that comprehensive report. Councillor Corey.
Thank you, Chairman. My thanks to our Chief Fire Officer and the whole fire service for how they all responded following receipt of the report on 15th of December. Not wanting to preempt any questions and comments from members this morning, I'm satisfied that the work that has happened since the inspection 12 months ago has put Lincolnshire Fire and Rescue in a much better position, as we've heard. The record keeping and communication of our equality, diversity and inclusion awareness is much improved, and steps have been put in place across the board which make sure this is embedded, including me taking a strategic lead as I now attend the County Council's Corporate Diversity Steering Group meetings alongside a senior fire officer. And this ensures that all our activities are in line with the County Councils. And I know that this equality, diversity and inclusion awareness raising has also been an integral part of our recent whole-time firefighter recruitment process. On the matter of protection, I'm also satisfied that the risk-based inspection programme is also much improved, and our what they call upskilling of our inspectors has given us adequate resources to fulfil our target audits. And you've just heard our chief confirm that we hit our high-risk inspection targets following last year's HMI report. Through my monthly meetings with the Chief Fire Officer and weekly written reports which set out progress against targets, I know that our officers have put resources in place to remedy those issues and comply with the requirements as set out in Roy Wilshire's letter of 14 December, which is in our packs. As you know, Chairman, the effectiveness of Lincolnshire Fire and Rescue to answer emergency calls was never in question, and all our statutory duties were found to be acceptable, as was our major incident response and our partnership working. And I'm pleased to confirm that HMI acknowledged this. HMI also recognised that Lincolnshire Fire and Rescue is well resourced and well supported by Lincolnshire County Council, as is the care of our firefighters. And finally, I will continue, you'll be happy to know, I will continue to monitor the activities to ensure that the necessary improvements are embedded and that we continue to improve and aim for outstanding. And it is worth noting at this point, as we've already heard, that HMI came to re-inspect Lincolnshire Fire and Rescue our week commencing 28th of February this year, and I attended the hot debrief with HMI on the 7th of March. As the Chief has already hinted, but we don't want to preempt the outcome of that inspection because we will be receiving a letter later this week, but we are assured that the contents of the letter will be positive. So thank you, Chairman.
Thank you, Councillor Corey. Councillor Brockway.
Thank you very much, Chairman. Thank you very much for the report. That was very interesting. And my response to this is going to be a bit cavalier. I actually feel that HMI has crossed a boundary with services like the fire service. I have the highest regard for Lincolnshire Fire Service. I think it's amazing, okay? And when invited, I attend my local fire station and I can see the spirit, I can see the work, I can see the efforts, and it is superb. But looking through this report, I found things like action plans, reviews, awareness, develop, prioritise, assess, criticise, jump through hoops. All I want from you is that you are strong enough and fit enough to get up that ladder and get me out if I'm stuck in a burning building. And that is the awareness of the public as well. Nobody gives a monkey's whether you've got 5,000 pages of reports and whether you can tick the boxes. And I think it's important to raise this. I'm raising it in a kind of jokey way, but I think it is terribly, terribly serious. Targets are constructs. They're a fake thing, okay? The target is that we want nobody to die in fires in Lincolnshire. Okay, that is a target. That would be wonderful if we could achieve that. But by HMI introducing all these deviating pieces of work, it's taking from the core work. And I think that an awful lot of targets can be very undermining. And when we're asking people to go into buildings and situations where we're saying to you, we want you to risk your life to save us, the last thing they need to be thinking about is EDI or anything else, frankly. We need them to concentrate on the core, which is basically to save lives, okay? So I almost feel that HMI needs to be taken to task here. Targets are, I'm reading some of these targets through. One here, okay, a random one, page 58. The service should put in place a specific process, so they want a specific process to identify, develop and support. So 3 parts to this specific process: high potential staff and aspiring leaders. Now the thing is, the fire service is split into a number of very small units, and these aspiring leaders tend to identify themselves. They come forward. But no, HMI wants a plan, a process with different sections. And I'm really sorry, I think they've got to a point where it's really ridiculous. They're asking our people to jump through hoops, and I do think maybe it's time for the public sector to turn around and tell them to get lost. I did tell you this would be a bit cavalier, and I haven't finished yet. The other thing that really worries me is that our fire service is being asked to identify and be judged on targets where there are so many variables and so many inputs that they're not fully in control of the outcome of these targets. If you take education, they can educate people until they're blue in the face not to light candles, not to leave candles burning near curtains and things like that. And then you get something that comes along on the internet saying, oh, let's light a candle for this, let's light a candle for that. And people are taken by the emotion of the moment, and all the education goes out the window. But it's the fire service that's judged on this. So I do feel very strongly, I think you're superb, actually. I'm absolutely 100% behind our fire service. And if you want a letter in support, I'm your girl. But I do feel that maybe we should be challenging these people now, Chairman. We mustn't let them damage and make our fire service feel in any way that they are inadequate. I mean, when this came out, people were disappointed, and they shouldn't have been made to feel that way. So I'm in fierce fighting mood here. We need to get behind our fire service and support them to the hilt. Thank you, Chairman.
Thank you. Councillor, Mrs. Clark? Mr. Clark, sorry. No, Mrs. Clark. Okay, then Mr. Clark.
Me?
Yeah, go
Me?
ahead.
Thank you, Mark. Thank you, Chair. Thank you, Mark, for that really open, wonderful report that's full of information. And every time you come to this Scrutiny Committee, you deliver all this detail. You're able to talk about it. You know about it, and you've understood it. And I want to thank you for that, and thank you for keeping us safe. I know there's an awful lot of information here, and you're dealing with people, you're also dealing with your own organisation. But I wonder if I might just touch on an item there on page 68, which is to provide unconscious bias training, which might actually agitate my colleague in front of me who's just been talking about these very points. I think they're really important because when you're a huge organisation and you're part of a countrywide organisation, different units, but you're part of a countrywide service, you're dealing with people and employees. And so I wonder if you might just expand on what unconscious bias training is. I understand what it is myself, having worked a little bit around it, but if it goes unaddressed, it can create biases, it can impact on the workplace culture and team dynamics. And in a professional workplace, it can affect the way in which you interact with your colleagues and make business decisions. So I wonder if you'd just expand a little bit on that. And also, did you use an external provider for that, or is it in-house training? Thank you very much.
Okay, thank you, Councillor, and thank you for your words. Yeah, unconscious bias, that is absolutely, as you've identified, links into our wider EDI agenda. Particularly unconscious bias is really important, and I'm going to pick on two areas really. One is specifically within our recruitment and retention, because actually what this is about is ensuring that right from the beginning of when anybody has a first interaction with Lincolnshire Fire and Rescue in regards to a recruitment process, we need to ensure that our recruitment teams and our managers don't have, and I'll say what it is an unconscious bias against certain traits, characteristics, beliefs. Now, what we mean by unconscious bias, these aren't conscious overt biases or people who are deliberately putting barriers in the way of people, but these are the things that are ingrained in every single one of us. We all will have an unconscious bias about something or someone that has been developed through us, through our upbringing, our own experiences. But it's important that actually we train people that they can recognise this, because once they recognise it, then they can actually make better decisions, more informed decisions and recommendations in regards to how we support people being recruited into the organisation, either being promoted within the organisation, to ensure that we've got the most diverse workforce that we can have. Because the more diverse workforce we have, then we have wider conversations, more eclectic opinions, and it prevents us from just doing the same things that we've always done. It helps us grow and it helps us be able to develop as an organisation. In regards to the unconscious bias within our day-to-day work, again, it's just as important when all managers and all people are having conversations, or if they're making decisions or they're making plans, that they're recognising what their own barriers are for them to be able to explore wider opportunities, to explore greater thinking. And again, that will come from biases that we've all grown up with, that will have deep-seated opinions on us. And this isn't about us changing those opinions, and it's not about us saying that actually, no, you need to think like this and you need to think like that. People should have the freedom to think how they need to think. It's about people just being able to recognising what those preconceived biases are, so then they can actually have far more of an informed way of making decisions. The way we're doing this, and we've done this in several streams. First of all, it's part of one of the work streams within the foundation training that's being rolled out to all members of staff within our one-to-one, face-to-face, sorry, not one-to-one, sorry, our face-to-face training that is being delivered by an external company. And they are currently going around our stations, our departments, our teams, and delivering this foundation training. And unconscious bias is one of the areas within that. We're rolling out and supporting unconscious bias training packages through Links to Learn to ensure that people at least get an understanding of what unconscious bias means. And then it's work that we've linked in with another external consultancy that have came in, and they've done specific unconscious bias training for and I'll probably class it as our higher risk areas, such as our recruitment teams, to get them to understand more about unconscious bias. So we've done a bespoke training package with them. So we're hitting it in various levels, which is really just people trying to get a better understanding of themselves, to ensure that, again, which is an ethos that we're trying to promote, is so every single person within the organisation can be the best versions of themselves, which will enable them to make better decisions, which can ultimately make the organisation grow, which keeps going back to my point, which will enable us to serve the people of Lincolnshire better, to make them safe and well, which is a thread that we keep through on all of our training. I hope that answers your question.
Okay, Councillor Mr. Clark.
Thank you very much, Chairman. I was interested to read a bit about the efforts you're making about diversity. Have we done a comparison on the county figures to compare them against the firefighting figures regarding the diversity of ethnic groups or European groups, so we have an idea of our percentages, or even possible numbers if you can break it down that much? And I was also wondering, on the fire prevention, do we produce anything in a foreign language in order to target certain groups? Could you answer those questions for me, please?
Yeah, absolutely. I haven't got the figures at hand, but we do monitor in regards to Power BI, which is the County Council's performance management system, where we have our EDI figures against the actual LCC figures. In regards to BME ethnicity, we are very similar to LCC. The area where we are below the percentage is in regards to female employees within Lincolnshire Fire and Rescue. We do have a disproportionately less female employees than the LCC. So that is an area where we are working in regards to positive action, in regards to going out into our communities, and probably asking the question, and for us to really get an understanding of, is what is it that women within Lincolnshire or wider than Lincolnshire, what is their view about what barriers, or why do they not think that Lincolnshire Fire and Rescue is an employer of choice for those? So once we get more of an understanding for that, then we ensure that we can have more targeted positive action to ensure that we can attract a greater diversity within our recruitment teams. And we also do that targeted positive action group, particularly in regards to areas such as in Boston and Spalding, to ensure that we reflect the communities, because we know we've got higher levels of Eastern European communities in there, because I think it's really important as a fire and rescue service that we do reflect the communities of Lincolnshire. I know there's lots of work in regards to national statistics, in regards to percentages across the board. For myself, the priority for us is to ensure that we reflect the communities of Lincolnshire, because the communities of Lincolnshire is a different demographic than the communities of Derbyshire and Nottinghamshire. So with the greatest respect to Derbyshire and Nottinghamshire, the needs of Lincolnshire are different, and that is what Lincolnshire Fire and Rescue should reflect, and that's where we're putting our targeted work in regards to that. In regards to your second question, in regards to our prevention work, yes, we do. We all of our leaflets are accessible in different languages, and again, linking in regards to our targeted approach, where we've got languages that either, and I'll use either the Polish language as an example, where we know we've got Polish-speaking people in regards to the Boston and Spalding area, then we will targeted a lot of the leaflets and the information online to ensure that it is accessible. But we do print, and we do make sure it's accessible in as many languages that are relevant to the communities that we have in Lincolnshire.
Thank you very much indeed for that. I was interested in your working with Lincoln University. Could you briefly outline what this partnership is, please?
Okay, so that partnership was we partnered up with them and for commissioning a full report in regards to the evaluation of our prevention activities, and particularly in regards to the effectiveness of our safe and well checks. So our safe and well checks is a strategy that we deliver that goes and we go and we meet households and we do an assessment of their homes to ensure, in regards to being safe. And we offer smoke alarms. We ensure that they got understanding of having a fire plan, closing of doors, nighttime routines, making sure they got appropriate electrical sockets, not using candles, smoking, etc., etc. And we target our higher risk people in regards to that. That links into our Sherman concept. The partnership work that we've done with Lincoln University is, and it almost seems like a simple question to ask, but it is really difficult to get some of the findings of actually. So what is the impact of all the work that we are doing in regards to our prevention to give us a way of measuring if we're being successful? So I'm happy to share the report with the Scrutiny group following this meeting, which will probably give you all the details that you're looking for in regards to that. But the headlines are saying that actually in regards to the return on investment of what we commit to, we are getting, for every £1 invested, we are getting over £36 worth of preventative costs. Now, what we're talking about there, if we didn't do any of these safe and well checks, or if we didn't do these prevention activities, there would be a higher likelihood, a greater risk that people will have more fires. That in the event of a fire, the damage would be worse, or there would be more of a risk of life. It would commit more of our resources, longer incidents. So actually the work that we are doing in our prevention activity is indicating through our safe and well checks that it is making a positive impact in keeping the people safer in regards to the risk of and also in the event of a fire. Again, I'm happy to share the report following this meeting to members. That'll probably be more helpful for you.
Thank you very much indeed for those comments.
Okay, thank you. Councillor Lee.
Thank you, Chair. First of all, Mark, thank you hugely for a really good detailed report and all of your comments on it. You've gone into a huge amount of detail. I wanted to comment on the areas that are mentioned on page 52. First of all, looking at people, I would say we expect our firefighters to lay their lives on the line on a daily basis. So I think it's really important that we do this monitoring. We do make sure that we're getting the right people with the right skills, that performance is being managed. You know, if somebody's got any kind of an issue with their well-being that needs addressing, that we recognise that. And if we don't inspect and look for it, we wouldn't necessarily know that. So I think it's vital. And going to effectiveness, you have to remember coming up to 5 years ago, there was a fire at Grenfell where over 70 people died. And that fire wasn't just it wasn't confined. The possibility of it happening wasn't just because it was in London. It could have happened anywhere across the country in any number of high-rise buildings. So it's really vital that we understand fires, we understand how to prevent them, and actually protecting the public through fire regulation is of huge importance. That emerged after Grenfell. So I think we have to recognise, I would say that this kind of reporting is absolutely vital, because if we don't inspect and check that we're doing these things, how do we know that we're doing them and that we're not missing something? So I would actually say completely the opposite to the first comment. I absolutely understand the need for this kind of report, and I thank you for the report. And as somebody who's got quite a few friends within the fire service, and I utterly respect the contribution that all of you make, I think that this is vital, and I would say thank you very much, and just keep doing this, please. Don't just leave it to chance. Thank you.
Thank you. Councillor Gray.
Thank you, Mr. Chairman. Thank you, Mark, for your very thorough report. Just before Christmas, I was invited by Councillor Corey to attend Horncastle Fire Station, which is in my division, and we had a great evening. Actually, it was a training evening. I didn't know there was a training evening we were attending, but we did. We sat in. I was just very impressed with what I saw. I mean, clearly there was great teamwork and a real sense of understanding of the subject being discussed. I spoke to officers. There was a female firefighter. And just everything about the evening, the well-being of those team members appeared to be absolute paramount to me. So, Councillor Corey, congratulations, because, I mean, this report doesn't really reflect and give us the clear picture of the great work that Lincolnshire Fire and Rescue are doing and the great service there is to the people of Lincolnshire. So, congratulations, because you should be very proud.
Okay, thank you. No one else wishing to speak. Okay, I've got one or two things there to mention that... like Councillor Brockway, I have and always have had the highest regard for Lincolnshire Fire and Rescue, and I've often referred to it as the jewel in the crown of Lincolnshire County Council. Many times I've said that in this chamber, and I'd be one of the first to jump to their defence. However, as a scrutiny committee and your critical friend, we have to scrutinise what is put in front of us and tease out what is put in front of us, no matter how comfortable that may be. Councillor Lee raised some good points. We need Her Majesty inspectors and whatever to look into these matters. And one or two queries I have is on page 52, which we've had the assurance from yourself, Mark, and also from Councillor Corey, but the 11 areas the inspector looked at since 2018, 10 areas have either stayed the same or got worse. The inspector uses the words, and I hate to say it, regressed, and it was also in the press that the service has regressed. But pleasing to hear we're improving on that. But only one area out of the 11 showed any signs of improvement. Hence, the inspector stated that the service has made some progress, but progress has been slow, and the service does a lot of work to do. Mark, I'd just be interested to know, was that expected? Did that come as a surprise to you? Or as a disappointment? If you just come back on that, please.
Okay, I'm kind of going to answer that and in both the ways. I'll be absolutely clear. Of course, I was disappointed. I'm in the privileged position of leading an organisation which I'm extremely proud of, that I've worked with for 30 years, and I've known no other service. So to get a report which says that there are areas that we require improvement, of course I'm going to be disappointed about that, because I know that Lincolnshire Fire and Rescue is a good organisation, and I want it to be the best organisation it can be. In regards to your specific question, was it going to be a surprise? No, it wasn't going to be a surprise, and I say that because leading up to the inspection, the conversations that we were having with Her Majesty's Inspectorate and with my fellow Chief Fire Officer colleagues across the country, it was recognised that this round of inspection was going to be a far deeper dive. It was going to be far more robust than the 2018 inspection. HMI were very clear that they were going to be far more critical in regards to the areas they're inspecting. And I think this is a recognition, and this is a recognition by HMI, that they are an evolving and learning organisation, and this is only the second time that they have done a full inspection, and so their benchmark has changed, and I think that is evidenced in the fact that out of the 13 services, they pretty much every service had a reduction in regards to their inspection gradings. So as I said near at the beginning, we are pretty much in line with all the rest of the services. Back in 2018, benchmarking us against the rest of the service, we was pretty much in the middle, and now in 2021, we are again pretty much in the middle. So the benchmark has slightly changed from HMI. Now, I say that notwithstanding the fact that there isn't room for improvement. Clearly there is. And until we are getting goods across the board and aspirationally getting outstanding, then I will always be disappointed while there's an area for improvement, because I know we can improve.
Okay, thank you. You compared Lincolnshire Fire and Rescue to other counties, but if we do a comparison with the bordering counties such as Cambridgeshire, they came out good in every area apart from one. You'll know why I'm asking this question, Mark, living right down the south of the county and more or less having 1 foot in Cambridgeshire and 1 foot in Lincolnshire. But 7 out of the 11 areas, they came out better than Lincolnshire. 7 out of 11 areas better than Lincolnshire. Why could this be? Is it, are we lacking equipment or infrastructure? Why can they be better than us in all those areas?
I think in regards to looking at Cambridgeshire, they have resources allocated in different areas in regards to how they are working in, particularly in regards to their prevention areas, particularly in regards to supporting in regards to the EDI areas and their people areas. In regards to the actual effectiveness and how that we respond to emergencies, I think we're pretty much in the same ballpark as Cambridgeshire. I think it's. I think you can't get away from the fact that actually Cambridgeshire is a very well-funded organisation, and that's not me saying that Lincolnshire Fire and Rescue aren't, because we have absolutely fantastic support in regards to Lincolnshire County Council. But actually, there is a trend of county council fire and rescue services against the standalone fire authorities, where they do have a different resourcing model. Now, that is not something that I think is necessarily a good thing or a bad thing. I think it is a recognition, actually, that what we need to learn from a county council fire and rescue service is that what we haven't done as well as is actually articulate and evidence the partnership working that we do within county council that will enable us to get from the requires improvement to good. So I think once we did some debriefing and analysis of why we didn't get a good in some of the areas, and actually probably the frustrating thing that we have within our organisation is we know the work is there, and we know that we are better than what the some of the judgments has. We just didn't evidence it as well as what we should have done. And actually, on reflection, we should commit more resources in regards to preparing ourselves to evidence and deliver the good work to HMI for them to be able to give us a judgment. As HMI have said to me on several occasions, it's not that they don't think we are a good organisation, it's just that they haven't, they know it's there, they just haven't found the evidence to be able to triangulate it, to put it into a formal report. So it's learning from us as an organisation that we need to get more smarter in regards to how we work in partnership with HMI to get those gradings where they should be. But again, I will always caveat that this isn't about us just getting gradings. It is about us making sure that we're the best organisation for the people of Lincolnshire. So I know the work's there. We just need to be better at evidencing it to ensure that the public has that same amount of confidence.
Yeah, thank you for that, Mark. You'll know that I have quite high standards myself. You'll know that you have some of the best equipment and appliances in the county, and we just want to be reassured that we've got the best firefighters in the country too. But one or two other bits and bobs. Page 53, second bullet point. It mentions there about the mobile data terminals on appliances, but noted that better systems are required to keep risk information timely and accurate. At last month's OSMB meeting, we were told that the MDT refresh had a closure date of November 2021, but presently on hold as the project sponsor currently on sick leave. It's also looking into software renewals and upgrades. The MDT, as you know, has become a vital piece of equipment, and we don't want any delay on that. So could you just give us an update, please?
Okay, yeah, so where the MDTs, the mobile data terminals, for everybody else is probably a reference. This is a piece of kit that we have on our appliances that gives risk information about premises and properties that we're responding to. So our operational crews have all the latest information that they will need to ensure that they can fight the fire in that premise appropriately. Our mobile data terminals, we've invested in all the hardware and The challenge we've had is in regards to linking the networks through our LCC properties to ensure that our data platforms that we hold, our risk information, is able to talk timely and accurately through the Wi-Fi systems to download onto our appliances. That's worked through a Wi-Fi network on every single one of our station appliances. There's been a challenge in regards to the link from the Wi-Fi going through onto the MDTs that has sometimes been in a delay. So when the appliances move out of the station, the Wi-Fi doesn't always kick in, and it can sometimes take them up to about 30 seconds or so going down the road before the information is downloaded onto them. That's been worked through. That resolution has been fixed since the inspection. So we do now have the confidence that actually when we have risk information that's been updated in regards to our master data sets, that is being sent through immediately through our systems and downloaded onto our MDTs. And on nightly, every single station gets a full update of any other upgrades and information that requires on the MDTs. So they have that every 24 hours updated. And when they do drive out of those appliances, those connections now do work as we would expect them to have worked. In regards to the challenges we've had in regards to our third-party providers, we recognise that there is a fragility in regards to we are relying on one point of contact in regards to making sure the updates. That's being worked through some contractual discussions to ensure that we have better resilience, to ensure that any issues or concerns that are being able to address can be done and immediately due to the nature of the fact that we are an emergency service.
Thank you, Mark. Another one on page 53, the fourth bullet point, it says that prevention activities need to be increased to deliver to the most vulnerable and hardest to reach communities. There is too much reliance on dedicated specialist prevention team to deliver on in this area. You'll know that over the years there's been numerous house fires in our county, sadly whereby the dwelling has been in a remote area, and when the fire and rescue service have attended, the dwelling has been completely gutted, and sometimes sadly with fatalities too. I can recall a conversation following the 2018 report whereby some of these people in our county are almost recluses and will not entertain or engage with people trying to help them. You only have one resource, Mark, that can make any difference in your toolbox, and that is your on-call firefighters who know these people and are able to talk to them in a certain way. I believe the inspector realises this, and is anything being done to rectify this?
Yeah, absolutely. And we had recognised, and actually that programme of ensuring that our on-call firefighters can support more in regards to our prevention activities was already agreed and being rolled out just before the inspection programme. However, I think it's exactly one of those areas that actually the inspectors wasn't able to gather enough evidence to be able to articulate the benefits of us utilising our on-call. So particularly, and I'll use examples of particularly in regards to on the East Coast, particularly over the last summer period, our crews, for example, from Mablethorpe and around that area were doing quite a lot of prevention activities, particularly recognising that actually during the summer months there could be a higher risk due to the tourist industry coming through. We also are linked into Boston, where our on-call crews are going out and about in regards to our vulnerable communities, particularly in regards to our Eastern European communities, particularly as some of our on-call firefighters in Boston are from the Eastern European community. So your point being, and actually our on-call firefighters know our communities better than anybody else. So yes, we are utilising our on-call firefighters to go out there and deliver our prevention activities. We've ensured that we provided sufficient budget for our divisional teams to give them the flexibility for them to identify where our hard to reach, where our high risk areas are. So our divisional commanders work with our stations to identify where there's going to be our greatest benefit. We will always have the challenge of specific community areas that are, using your words, quite reclusive and hard to reach. And again, this is a challenge that is probably my greatest concern. There are communities out there that we won't necessarily know about as a fire and rescue service, but somebody does. Community groups will know about them, local communities will know about them. So it's about how we can link into that intelligence and that information to enable and direct our crews to go out there and support those really hard to reach communities. Because it's, I do reflect that probably one of the most difficult things to hear is after a fire, somebody comes to tell me from a community group or from another part and said, oh yes, we was aware of that, that community there, but we wasn't. So there's more work that we need to do to ensure that we are linked into as many community partnership areas as we can to ensure that we've got the best picture to ensure we can help our most vulnerable people.
Thank you, Matt. Councillor Corey.
Thank you, Chairman. On that point, I think we need to remember that Lincolnshire Fire and Rescue is an executive function of Lincolnshire County Council, and there may be incident, and I think it's a little unfair to put so much pressure and so much responsibility on our on-call firefighters to feed this information, because Lincolnshire County Council and our districts will have a lot of intelligence too. And I think there's fear of falling foul of GDPR, which means that our officers and our partner organisations don't bring forward information which may prevent deaths or serious injury. For example, those people who are living in social isolation, those people who are hoarding, those people who have mobility issues or who are smokers. So it's not just on-call firefighters, it's every part of Lincolnshire County Council, and it's all our partner agencies as well, because after all, that's why we're partners in this.
Sure.
Thank you.
Thank you for that, and I'm sorry that you saw it unfair, but if you look at the HMI's website, he says promoting improvements in policing and fire and rescue services to make everyone safer. And indeed, this is our role today, to make sure everyone is safer. And Mark will know this, there's virtually, I use the word recluses, I'll pick these people out, there are people in our communities who won't engage with people, but they will engage with some people they know. And a lot of these times they're the retained firefighters within the communities. I wasn't suggesting for 1 minute that should become their role, but they'll be the only people they talk to. Indeed, where I come from, there's a someone who lives in a caravan. Well, it's a dilapidated caravan, it's almost crushed to the floor, but he sleeps in there on a nightly basis. He won't talk to anyone. He'll talk to me, but he won't talk to anybody else. He talked to me when I was in the fire service, yeah. I used to provide him, even though it was a caravan, with things like torches and things like smoke alarms and things like that. So I guess you'll probably have a better understanding now where I'm coming from, in as much that a lot of our on-call firefighters know some of these people and in these conditions.
Thank you, Chairman, accepting that, but maybe that's something for Scrutiny to look at. And how well do our partner organisations and other functions across the County Council share that information?
Sure, that is why I scrutinise and tease these things out today, so it's got to be good. Yeah, thank you. Okay. Nearly done, Mark, and you never cease to amaze me how you have your fingers on all the buttons, so thank you for that. And there's just 1 or 2 more bits and bobs to come out. HMI Roy Wilshire points out a worrying factor, saying that is worrying that so many operational posts are temporary. And he puts this can cause uncertainty among staff and be detrimental to their well-being. Quite strong words from the HMI there. This also suggests a lack of workforce planning. This, I understand, has been endemic for some time. Has the service got to grips with inspectors' worry, please?
Yeah, I think this also reflects the the position where the fire service is as a whole sector nationally at the moment, I think it's fair to say that we've never been through a more fluid time in regards to workforce profiling and the movement of people through the fire sector. But fire and rescue service has been traditionally relatively static in regards to workforce profiling, particularly in the last 2 to 3 years. We've seen more people move from the fire service than probably from any other time that I can remember. In regards to the particular areas where Royal Wiltshire was intimating is what we're recognising, if I'll take one area, which is our protection activities. Protection is an area where it's not a question of just recruiting somebody in and then on day 2 they're able to deliver the full functionality of the protection team. As I've mentioned previously in the report, once we recruit people into our protection team, it takes them about at least 18 months to get fully trained. So in regards to the workforce profiling and the workforce planning, we are ahead of the game in regards to recruiting people for what we are going to require for the next 18 months to 2 years in place. If I can give you a tangible example of this, we've recently recruited personnel to be coming into our fire protection as fire inspectors. They will take 18 months to train. We've done that now because we are anticipating in 18 months' time there'll be changes in the fire safety bill, changes in regards to legislation and statutory duties that will more than likely have an increased demand in regards to our protection activities and how we support our local communities. So we're recruiting people now to ensure that we're going to be in the best place when that fire safety bill comes through, and we will have an increase in demand. In regards to the wider areas of temporary positions, our recent whole-time recruitment process that this is our second tranche of it. Our first tranche of our firefighters are now on stations. We are currently in the middle of training another tranche of whole-time firefighters. Once they are fully trained, they will be out on stations, which will alleviate some of the workforce pressures in regards to temporary positions, because we'll have more people to be put in those places. And also in regards to the middle management and senior leadership area, I've been interim chief fire officer for 18 months, which has a knock-on effect through the organisation as well. And the county council they've put the processes in place to address that in the next few weeks, which will have a knock-on effect to create stability through the organisation, which will again alleviate some of those temporary positions that we've been put in place. I do see it twofold in regards to the subject of temporary positions. One, in regards to actually, yes, we do need stability where we can get it, but actually there are some benefits of having the opportunity to giving people temporary positions in areas where they would never normally work in, which can give them development, it will give them accessibility, and to ensure that they can be developed. So we do like to utilise temporary positions on an ad hoc basis because it does help people grow in their development as well. So there is a bit of a two-sided coin on regards to that, and we do need to ensure that we utilise our resources as efficiently as we can. But absolutely, we are now in a position where stability is coming to Lincolnshire Fire and Rescue, and our workforce planning is now owned by our strategic resourcing board that is always looking at the next 18 months, 2 years and 5 years plan and the life cycle of our community risk management plan to ensure that we are recruiting now for our future risks.
Thank you, Mark. I've got a number of questions, but I know you're at the end of the phone anyway, but just one more. The HMI report states that the services on-call availability has been declining for years. We all know that. It's not just Lincolnshire, it's nationally, but I think your aim was to be available 91% of the time, and I think you achieved 87.6%, but that actually increased because of COVID. But now COVID's settled down, what is the percentage availability of on-call staff now, please?
I've not got this month through at the moment. I think and again, forgive me, I'll be accurate, I'll be ballpark. I think we ended up at around about 79% for our on-call availability for the last year. We do recognise, yes, our on-call availability is a challenge. It's probably one of our biggest challenges in regards to how we support our on-call personnel. And again, I think when we put this into context, 79% is a figure that we're not used to. But again, I do speak to my Chief Fire Officer colleagues. Many services would be pleased to have 79%. However, that's not a position I will want to be satisfied with. But I think it's also important that that having a blanket target is something that we'd like to be a bit more sophisticated with. I think it gives us a good indication in regards to the full availability, but we also need to recognising actually there are some probably higher risk areas within the county where we need to focus to make sure that we have a higher priority in regards to increasing availability. So what I mean by that, through our community risk management plan, we have really good data that identifies where our higher risk areas are within the county. So it is only right that they are the areas that we have a clear focus on, ensuring that those stations have the highest availability that they possibly can have. What that doesn't mean is that we are content for other stations to have a drop in availability, but what it means is that to ensure that we can have our resources aligned to where our highest risks are, there will be some stations that will always naturally have a higher availability than other stations. So we need to ensure that we are resourcing to risk. And what that means is actually having a blanket 91% or a 95% on every single station probably isn't realistic, but also it also doesn't necessarily meet the demands and the needs of the risks of those communities. So we are looking at it in a far more risk-based process and a far more sophisticated process in regards to how we report on our on-call availability. Notwithstanding, we are still recruiting more on-call firefighters than what we have done in previous years. And we've actually developed different training packages and trainee courses to ensure that we can get people riding the appliances quicker than what we have done previously. So I think the challenge is less about actually recruiting people in. The challenge is in regards to when we've got the people recruited to the stations that we can ensure that we've got them available at the right times, at the right stations to ensure that we meet the risks of Lincolnshire.
Thank you, Mark. Clearly this will come back to us at some point. What sort of timescale do you think it ought to be to come back to us?
HMI, they are looking at coming back to do another visit in about 6 months' time, particularly on protection activities. So my recommendation was once we've got the outcome of that, then we could give an update in regards to the findings of our progression of protection, but also a more general update in regards to all of our areas for improvement. So for that timely thing, so I can bring it all together in one report.
Okay, thank you, Mark. Councillor Lee.
Thanks, Chair. I was frantically trying to catch you out way back now when you made your previous lots of comments. I completely support what you say, and I think this committee is the place where we might ask the tricky questions, if you like. And actually, you know, we're here to scrutinise, correct me if I'm wrong, and I could be wrong, as a committee we're here to scrutinise the performance of the fire service from the perspective of Lincolnshire County Council. And whilst partner organisations will have an impact on that, I don't really feel it's our role in this chamber to be scrutinising partner organisations at all. You know, and if people don't like that, then and that's uncomfortable, then I understand that. But perhaps we can have some clarification about that. But I completely support the comments that you make. Thank you.
I must say it's uncomfortable for me. pride in our fire and rescue service. I don't want to be sitting here saying these things, but that is our role as scrutiny. Councillor Corey.
Thank you. Just to clarify, thank you for your comments. When I said partner organisations, we do work with districts. We've got contracts in place with districts to make sure that if their housing officers go and visit a house and there are issues there, then they will tell the county council as the deliverer of social care if there are issues. Then our this partnership communication should then pass on through the Sherman initiative to Lincolnshire Fire and Rescue that there are issues in this house. We think that there could be a fire risk. Could someone go and have a look now? This is not happening at the moment, I understand, to some extent, because there are GDPR issues, because people are worried. We're in a different organisation, so that information's not getting through. And that's where I said partner organisations, really, can we have a look at that? Is this working? If it's not working, how can we make it work so people, as you've described earlier, Chairman, don't get left behind, and we can support them, because that's what we're here to do. We're here to support them, but put in all that emphasis on just our on-call firefighters when there's a whole machinery set up for just that. Is it working to best advantage?
I don't think anyone in this room suggested, me included, that the onus was put on the fire service. Just to clear that point, Councillor Brockway.
Yeah, thank you, Chairman. Councillor Corey has just said some of what I was going to say, but I think it is the one thing I wanted to say. I think it is very important that while, yes, we are here to scrutinise, and we do that, I think it is important for us to see that the scrutiny is actually appropriate. And well, the reason for my little rant earlier on with regard to this is that I do feel that HMI has crossed a boundary which carries its own risk, because it's deviating our people into minutiae that take them away from the core function. I'd be very interested at some point to have a cup of coffee with the Chief Fire Officer to see if he actually agrees with that. It's about protecting them as well as scrutinising them. Scrutinise them, but scrutinise everybody around them as well to see that it's safe. Thank you, Chairman.
Yeah, thank you. Any further questions? No, so thank you, Mark, but not just you, Mark, all your colleagues too, for trying to meet the requirements of the report. And as I said earlier, it never ceases to amaze me that you've got your finger on all these buttons, and I, for one, am more reassured now by what you've provided with us today than what I was when I read in the report. So thank you for that.
Thank you. Thank you all.
Thank you. We'll now move on to, I think you've got to go, Vice Chairman, haven't you? Oh, sorry, I didn't do the proposal there, sorry. Yeah. Good job I got you there, Trina. It went on long enough, I was just trying to get out of it, yeah. Okay, so the action to this committee is invited to... bear with me. I'll get it. Page has got out of order. Oh, here it is. Yeah, okay, sorry for that. Yep, the actions of this committee is we're invited to review and comment and note the contents of this report, note current progress against cause of concerns and accept the action plans, Appendix A, and 3, note the additional 17 areas for improvement and the scrutiny and assurance structure to address all areas. The proposal is that I move that the committee receives the report and that we are satisfied with the level of assurance provided by officers in terms of progress against causes of concern, and that we endorse the action plan as set out in Appendix C on pages 77 to 80. Furthermore, we note the scrutiny and assurance structure put in place to address areas for improvement. Lastly, I ask that our comments as captured are taken under consideration, and that a follow-up report on further progress is submitted in, I think it was 12 months' time, wasn't it, we agreed? Or was it 6 months' time? Did you capture that? 6 months. Sorry, in 6 months' time then, yeah? Be clear, 6 months' time to this committee. Can members please raise your hand if you agree? All agree, thank you. Thank you. You've got to go. Thank you, Vice Chairman. You've never seen so many bits of paper I've got here. We're under agenda item 8 now. Lincolnshire's Ukraine response. In the previous meeting of this committee, we asked that an overview of the support in place for Ukrainian refugees fleeing their country amidst this devastating war that is sadly ongoing. This report that can be found on pages 83 to 86 of your agenda packs, and it provides assurance on the arrangements established by Lincolnshire County Council, Lincolnshire's district councils and multi-agency partners to deliver the government requirements in relation to the Ukraine humanitarian crisis. I understand this is going to be presented again by Mark Baxter, our Chief Fire Officer, and with the assistance from SEM. So over to you, Mark.
Yep, thank you, Councillor. Absolutely. If I'm honest, I'm probably going to do a bit of an introduction and an overview, and Sam will probably lead on this, because the reason I say that is part of the ask that came through into the government, through into County Council, was to put in arrangements to ensure that we can support Ukrainians coming over into the county. Now, the part of that ask, when we looked and evaluated, is what we're recognising is it wasn't a specific Lincolnshire Resilience Forum responsibility. However, what we're recognising, actually, the structures and the ways of working that the LRF operating, and the benefits and the positives of the multi-agency working that we're used to, did present us with an appropriate structure, and from that, SEM kindly volunteered to take the strategic lead in regards to putting a group together, being supported with Lauren Grosner, to ensure that we had that joined up multi-agency work that was able to link and liaise in regards to the Home Office, in regards to the direction from government that does come through quite on a changing basis, almost daily, definitely weekly, in regards to the asks of how we can support homes for the Ukrainian population coming through. So in regards to this report, this is a bit of an overview in regards to the structures and some of the high level priorities that we're having to support through LCC, the districts and partner agencies. So in regards to some of the details, which, bear in mind, I'm conscious of the fact that actually we can only talk about the level of detail on two levels. One, in regards to there will be a confidentiality element that clearly we probably won't be able to discuss at this scrutiny meeting, but actually in regards to the level of detail to ensure that the committee has the assurance and understanding that we've got the appropriate structures in place and the working regimes in place to ensure that we are able to support any Ukrainians coming into the county, then hopefully this will give you the confidence that we've got the right teams and the right structures in place to develop that. So that was a little bit my preamble introduction, Sam. If could I invite you, Sam, just to probably just give an overview of the things that you've put in place and any updates of where we are at this moment in time, because I'm conscious by the time this report was written, there's been a couple of weeks past and things may have changed even since then.
Thank you, Mark. That's really helpful. So good afternoon. For those of you who don't know me, my day job is that I'm an Assistant Director in Public Health. And as Mark said, I've taken the strategic lead around this area of work. Quite a short report for you, just in terms of providing that assurance. And I think the structure chart that is in there hasn't changed over the last couple of weeks, but hopefully just gives you a sense of the controls that have been put in place to make sure that we're drawing all of the support together into one place and have a strategic approach across the county. We are very fortunate that in Lincolnshire over the last few years we've had a very robust resettlement partnership chaired by Phil Roberts, the Deputy Chief Exec at North Kesterton District Council, which has overseen the arrival of Afghan evacuees last summer and also asylum seekers, and prior to that, Syrian refugees as well. So we have a lot of infrastructure in place, and we have drawn on that and our learning from COVID to inform this response. I'm sure somebody will ask me if I don't tell you up front in terms of the numbers currently. So I can tell you and I'll send these through for the notes afterwards. For Lincolnshire as at last Thursday, which is the latest set of numbers we have 279 hosts in Lincolnshire who have been approved. Of those, we have checked through our district council colleagues 188 of those properties. We have initiated so far 240 DBS checks, and of those we've had 59 back. We have now confirmed that 23 sponsors have received their arrivals. That number is slightly higher. I haven't had the latest today, but we know we've had a few extras over the weekend. And this week, Mark's colleagues in Lincolnshire Fire and Rescue will start doing safe and well checks, which is a follow-up to the initial housing inspection, and is, again, some of the things Mark's been talking about around the sort of home safety checks, the liaison with people, falls very nicely into that category for us. So just in terms of the structure, it does give us the reassurance that all the key players are around the table. We had the latest government's guidance came out on Thursday, quite late in the day. There's still a lot of government guidance to come forward. It's very much a developing and changing programme. But hopefully the report gives you the assurance that we're where we should be. Myself and Lauren Grosvenor are attending both regional and national dial-in conferences. There is nothing that we have heard on any of the regional national calls that gives us any concern or that we haven't already covered or considered. And in many cases, with things like the number of properties that we've checked, we are ahead of our regional partners at least in terms of making sure that those are moving ahead quickly. So in terms of the government guidance, as I say, latest came out on Thursday. Check that again today. Nothing outstanding that we should be doing that we're not already. And 23, probably around about 30 families now, sponsors now in Lincolnshire have received their Ukrainian guests. And I'll leave it at that point.
Okay, thank you, Sam. Any questions? Councillor Mr. Clark.
Thank you very much, Chairman. It's wonderful that we are doing this accommodation and welcoming, and I'll put them as visitors to Lincolnshire, because we're not quite sure how they'll progress and want to move forward in their lives. I take it we are producing or have a list of Ukrainian speakers that we can call upon for assistance, and I wondered whether we were actually producing any useful booklets or a booklet in the Ukrainian language that gives some useful facts about Lincolnshire. Thank you.
Through you, Mr. Chairman, if I can, the County Council's website includes all of the information from the government. It includes information for sponsors and for guests, and there is both a national and a local welcome pack, and the local welcome pack has been translated so that that can be received by people. Mark has also had some of the fire safety information translated as well, so again we've covered that off. In terms of a booklet, we haven't produced it in booklet form. Most of our arrivals have got IT, if not all have got IT access, and it means that we can keep it very live and very quickly updated. So yes, all of those things are in place.
Okay,
thank you very much.
No further questions. Okay, the actions of this committee were invited to consider and comment on the contents of this report and offer our views and make recommendations on actions taken and further actions required. I'm going to move that this committee receives the report and that we are confident in the activity undertaken by Lincolnshire County Council, Lincolnshire District Councils and multi-agency partners to deliver the government plans as these currently stand, and that we are satisfied that requirements are fully met in Lincolnshire. I also request that our comments from today's discussion, as recorded, are taken in consideration. and that we receive a further update. Can I suggest July, Sem? Sem, are you there?
Yes, that's fine. Yes,
Yeah,
happy with
further
that.
update in July to meet on the progress made. Can members please raise your hand if you agree? Everyone? Yeah, thank you. Okay. Agenda item 9, Public Protection and Community Scrutiny Committee Work Programme. This item is on pages 87 to 91 of the agenda pack. This report will be presented by Simon Evans, who's the Health Scrutiny Officer. So over to you, Simon.
Thank you, Chairman. Just to go straight to page 88 in the work programme, there are some changes. In fact, quite a few changes. I'll just focus on those that are impacting on the next 2 meetings. There is a suggestion that item 2 on the 31st of May is more of a general update on fraud rather than focusing on cyber fraud. And moving on to July, we've also got an update which has just been agreed by the committee, an update on the response to the Ukrainian refugees, and also on the 19th of July, bringing forward an item from the 20th of September, number 4 on the list, which is the recommissioning of the Domestic Abuse Service, which, whereas the committee will see on page 89, an executive decision is required by the 6th of September. Also, during the course of the morning, in addition to the Ukrainian response to the Ukrainian crisis, there's also been 2 further items added in 6 months' time in relation to animal welfare, and a further update on the Lincolnshire Fire and Rescue in response to Her Majesty's Inspectorate. There is, I think I'll leave it there, Chairman, because there are other items, but that affects the next meeting. Members of the committee are welcome to suggest items. Thank you.
Okay, thank you, Simon. Councillor Mrs. Clark.
Thank you, Chair. I was just wondering when the community trigger strategy would be brought forward onto the work programme, because I did suggest it some time ago. I know it's on the list for you to work in, Simon. I'm just curious. Thank you.
Sure. Simon, do we know that? Can we answer that question?
Apologies, Chairman, I can't answer that question, but we can certainly maybe discuss it at something to discuss at the next agenda planning meeting, see if we can slot that in, possibly for, well, I'm not sure whether it'd be too soon. May 31st of May, there's the lead-in time for that, so I think the earliest would be the 19th of July. But thank you.
Okay, so we'll make sure it's put in there somewhere. Yeah, Councillor Lee.
Thanks, Chair. Going to the meeting on the 19th of July 2022, I'd like to make a formal request that under item 4 that we also get an update on the Ermine Library Hub reopening. I have an email dated the 22nd of July, I think it is, of last year, that said it was being talked about. That came from officers. The provider was agreed early in September of last year, and it still hasn't happened. And I plan to ask a question about it anyway publicly, but I would like under item 4 to include a short update on the Ermine Library progression, because I just think it's disgraceful that a year in it still hasn't happened, and I think that deserves some scrutiny.
Okay,
Thank you.
I see no reason why that can't be in there, so we'll make sure it is. Yeah. Any other comments? So just to be clear, Simon, we've captured that animal welfare report will be coming back to us. A Majesty's Inspector report for Lincolnshire Fire and Rescue will be coming back to us. Lincolnshire's response to Ukraine humanitarian crisis will be coming back to us, yeah?
That's correct, Chairman.
Okay, thank you. So the actions of this committee is that we're invited to review the work programme and highlight any additional scrutiny activity which could be included for consideration in the work programme. So again, I'm going to move that we note the report and approve the existing work programme as detailed in pages 87 to 91 and the additional items just mentioned. Can I ask you to raise your hand if you agree? Okay, that's everyone, yeah, thank you. Sorry? Yeah, that's agreed, that's everyone, yeah. Okay, so I make that the end of the meeting. So that now concludes the business of the meeting. Thank you for your attendance and input today, and thank you for your attendance. You may now leave the council chambers and exit the Teams link. Thank you.